probably was the first crop, it will be. Yeah.
I did
get your email, I was on for training too, and then we were getting ready for here, so I haven't had time to even forward your information on that, but thank you, because that's the stuff that, you know, I'm looking for, this. I wouldn't know that otherwise, you know.
Great, good.
Good, glad.
Thanks a lot.
It's, they have, you know, as bad as we get sick of the things, you got it, it was, I just ordered, just red wine. Usually it's down for the system. Really? So I want a little rolly. That's usually what's right. So they're saying three, at least a good 3 weeks. I'm worried about. It's
How do you put it, like, home?
I don't know.
Yeah.
I don't like the dust. I get the pellet ones on side. I'm not dealing with a big there. Yeah. No. No, we did that and then we spent.
Gotta sweeten that soil.
That's the problem is. It's not even gonna speak. Literally, it's not control. It's got it off.
Let's get some tonight.
No, I think it's. You know, that sweet. Didn't that little top of the, where it goes down, in the right, right, something just.
People with shallow well. Yeah.
We'll see.
Yeah.
Yeah.
Me too.
Calling. I must. And they give me tonight, go into size. I think even
Really? Yeah, I can see you at Hello Kitty.
Oh, it was. Every time I thought I had you. There's so much other. It was like, well, I had to go to meetings. Yeah, Monday morning. I had to go to Nick Johnson. You're my meeting, I could have. Sure. Anyway, phone, yeah. This was like, this was him out in, this was him.
Sean
There.
Forster.
Sean
Forster. Sean Forster.
Oh, the founder, he's the one. The one.
The crazy. It's not a total.
Nick, Laura, first time, sure.
Yeah.
All property.
I haven't seen any. But you got the whole island.
Yeah, I suppose that's stuff.
Yeah, this is in fact, woods, that's the-
One,
It's full, yeah.
it's like, if I stir it up to the water, the temperatures come down. So we'll think the lines are high, it's easy.
Yeah, for sure.
Yeah.
Nice.
One second, then I will be ready.
It's very impressive.
And she's got, but it's gorgeous.
Yeah. for
You
sure.
know, it's just a dairy. Yeah.
Yeah, they didn't get it, so let's just.
Specifically for lunch, yeah.
Really
But so much today about the veteran cemetery that I didn't.
It's way over there.
Sorry. There's all this somebody can take it. One to one, I understand.
Yeah.
Okay.
Oh,
We go get money.
it's not furniture insurance, but I just questioning that.
You think it is?
No, something that you're doing. I'm not- That's what. That one.
It's, yeah, well, Cynthia tell you, she says.
Yeah. Are we ready now?
Yep, finally, I think we're all.
If I could ask everyone just to silence for seconds, please. And shall we rise for the pledge, please? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Good evening, everyone. I have just a couple quick housekeeping things. The board requests that all audience members be respectful to others by not whispering or having conversations during the meeting. This will allow everyone, including our minute taker, to hear what is being discussed by the board and other participants. Sound travels easily with the acoustics in this room, and any background noise makes it difficult to hear. Then our other one is our budget. This is a budget workshop. And the Board of Selectmen is holding this budget workshop to discuss budgets with our department heads. While these meetings are open to the public, they are workshop meetings and not intended to solicit public comment. The board may, at their discretion, accept some public comment, but they're not required to do so. The public may make public comments on the budget at the public hearing, which will be held in January, after the Board of Selectmen and the Budget Committee have reviewed the budgets. Okay, just in case someone's not aware of that. Okay. Alicia, we're gonna open with general government buildings, which is number 1.
Yes. Okay, so you want to do anything, guys?
Yeah. Good afternoon.
Good afternoon, board. I'd like to introduce my co-captain, Kyle. I brought him along because he's been a big part of what we have come up with as far as our budget. And I'd like to introduce him to the process that we have here in Belmont of going through the budget. When we entered into doing our budget, we had one thing in mind: only present what we need, not what we want. We know that the last 2 years going through a default budget, everything has been tight. We've tightened our belts. We've been able to meet our needs, but it's been a challenge. It's been a challenge. So we looked at all that. The majority of our line items here are service contracts that we have. We've worked tightly with our vendors to try to maintain or reduce or make a very minimal charges over the last 2 years as far as increase. The good news is all the annual inspections here on our buildings are done. Any repairs that need to be done to do that have been done. The furnaces have been serviced. Our equipment has been serviced. We are not looking for any new equipment. Our mowers are in great shape. Everything that we use is good, and we did the truck swap this year, and so far that has worked out fantastic. So we're not asking for any big items on that. Of all the line items that we did, by tightening our belts, there's 8 line items that you will see that we actually were able to reduce from last year. And the only thing that we added was the part-time help in the summer. We did put that back in. We have some big projects that if the budget should pass and we have the money, that we want to be able to tackle those. One of them, we have 4 pavilions over at the beach that the roofs are gone. They need to be done over. We have some repairs to both the mill. The dome needs to be repainted after all the weather that we've had. And we'd like to clean the upper floor of the town hall. We've been able to do the first floor by step ladder, but we need a lift to do that. So in the summertime, to be able to do that part-time help would come in. That way, two guys can go on a project, the other person can cover. Overall, from the 23 default budget, we're asking overall is a 6% increase. That's basically 2% for each year. So it's not a huge increase that we're asking.
Are you planning to do
I'm sorry?
are you planning to do the roofs yourself at the
Yes.
beach?
Yes. Chairman, they need to be stripped and then reshingled. We don't believe from looking at them, there's any wood rot, but if we don't tackle them soon, they would be.
Is that shingled or is that, it is shingled?
Custodial, services, I see that gone up a little bit. Is there a reason for that?
That is also a contract. Also, that's also a contract.
That's a contract,
Yes.
so they,
increased their fee.
Yeah.
Is that year to year?
Yes.
Is that
Yeah.
year to year?
Yeah. And that's for town hall and the PD. Yeah. Travis, do you have a question?
I think I did it, hold on, where did it go, right here? Well, what other service contracts do we have? It only shows the price of one of them, I just wonder what the costs were, you know, off the top of your head for the rest.
Which one?
Service contract line. It just shows the pest control cost for town hall, but then doesn't talk about anything else, it's pricing.
So we have the pest control, we have Otis, which is the elevator, we have the, I didn't
Twin Rivers.
break down all of the other ones.
Yeah.
So you asked, what was in
Can
the
we know the
line?
contract?
What's in the 360 line?
No, 250 is, no, I'm sorry, 240,
240.
240 line, Steve. It's easier to give the number.
Yeah.
Yeah.
Then we're not-
it's-
Yeah,
So we get, JP Pest for, the mill, town hall. We have some,
I think he's looking for like the exact.
you know,
That was, I was trying to see like what the costs were.
Like what vendors?
Yeah, the costs of the vendors.
A big part of that is the Otis elevator.
Yeah.
But
Yeah.
I can't speak highly enough of those folks. When I have a problem, I call them, they're right on it.
Not for our elevator here in PD.
So
Not PD yet.
Oh, this says Otis PD, that's a.
we have,
So that I've reached out to Otis, I think they've had a change of staff there, so I've reached out like 3 times because they gave us what we pay for like the elevator here, which is around the 7,500. And then we had reached out to them to add in the PD. I have not got an answer of, is it 75 and we're adding this and is it that? So I'm still waiting for a final on them for that. So I still have to come back to you guys with that.
so we can, our mission is to try to equalize having the same vendors for all the buildings. Right now, you have one vendor for the PD for the elevator and one here, a different one.
but is that because they're 2 different make elevators? I don't think the PDs and Otis is it?
PD's elevator is an electric elevator, where's that?
That
Electric.
one's electric.
Yeah, that's electric. And it's kind of unique in itself. The company that installed that is a very small company, just 2 or 3 employees. And the word that we're getting is that they want to retire out. So we're trying to get ahead of the ball there to make sure that we have service there.
So is that 50,000 gonna go up? Alicia, with the PD one, you thinking?
It may, but I also have put the mill elevator into the mill building repair and maintenance. That's why you see that line is more increased because it used to be before in the service contracts, but for the last year or 2, we've been trying to get it into the mill building repair and maintenance, but because we keep it in default, it doesn't get to where it's intended to go.
So that's line 911?
Yeah.
So you're
Yeah,
okay, so you're trying to get the Otis for the mills specifically in this one? Yeah, I see that, over to the right, got it.
So did you already add the 75 into that
So-
other line? Just in
no,
case?
it's not in there, just my details there, so I can review that. Where do you even see the detail? All right.
And on
To the right,
the new generator,
Otis for PD, but I don't have that in there for.
Oh,
PD.
it's not,
Yeah,
yeah, okay.
got it,
yeah.
all right, you don't have the cost on that one.
and on the new generator here at the mill, we do have a 5-year service contract over and above the guarantee that we all purchase, so we're covered that way too.
And what is that contract? On a yearly basis, they come back and service it.
They come back and service it.
You know what that costs?
They, I think it was $2,500 a year, if I remember right, with the contract.
Did we encumber for the heat? Is that
We
why it's
did.
a zero?
So any of the lines that you see, so we did encumber last year our heat line, our electric line,
Telephone.
our
That's why they're red.
telephone.
That's why they're red.
Oh, okay.
Yes, so the ones that are red are the ones that we did encumber, so they have been spent in our encumbrances, that's why you're not seeing them spent here.
Under that mill heat. Why do we have an electric bill for the mill heat?
We have to heat this building.
I thought the heating system in this building was,
So the 225 line,
925.
I said, why are we heating it?
Yeah, it's no heat.
There's mill heat, 12,000, it goes,
Yeah, that's
I
just
mean-
the cost of the heating oil itself.
what are we paying for you, or does anybody know? How much we paying?
Oh, that was,
It's in the up end. So we pay 2.547 for oil and 1.505 for propane. And we just locked in that contract, remember, John?
I just wanna make sure that
Yeah.
we get the discount from premium.
Yeah.
For those projects you guys had in mind, are those definitely needs to be done this coming year?
Yeah, the pavilions over at the beach are five years beyond where they should be as far as that. And they're heavily actually in the summertime, year round except for winter, are heavily used by groups that come in, sit at the picnic tables and use those. In fact, when we go over in the morning, there might be 2 or 3 of them in use already at 8 o'clock in the morning, and then throughout the day. So, they're well worth it. They were built by, as a Boy Scout project for Brian Jacks, way back. So, and so that's the original groups that are on there from back then when he was in Boy Scouts. So
Okay. There's a lot.
We have had, I believe, Woody or Ron, a couple of groups have reached out to do some projects, but still we just have to buy the materials. Did Sam ever reach out to you about what Lowe's was looking for as far as the project?
no,
I know,
I know Danielle has all the numbers and stuff. I had gone through and calculated and told her how many bundles and stuff would be needed. So I have to get with Danielle to get those numbers
there
again.
may be options to, I think it's more so the materials we need versus the, the labor. and-
sure,
Yeah.
right. Well, that's why I asked if you guys are planning to do
Right.
that yourselves.
if all
Obviously.
fails, we're doing it. We're gonna do it if all volunteers
If a volunteer, whatever.
back out or have a problem. That group, the Woody group, they're
Oh,
not the youngest people.
I was just gonna say that, and they're gonna get up on.
Yeah, so.
Yeah.
Kyle loves to be on roof, so.
Okay.
that's-
But they can supervise them.
I would recommend you get a hold of the Hewitt program. Happening program.
Right.
Oh, yeah.
One of my concerns here is I want to get this dome addressed. Because that's out in the weather, gets beat on all the time. And it's beautiful when you come in at night, and it's a great thing. I just want to get that serviced, get it repainted. If there's any rot, we'll get that done at the same time with the lift, so.
I also want to note that in the health and dental lines, I plugged in the 25 rates. We will not get our health and dental rates until next week, so I'll be able to update you with those numbers, but those aren't being released to me until the 10th. So I just plugged in old numbers. Obviously, we're kind of thinking that they're going to be 5.5% increase, right? Was it 5% for dental and possibly 10 to 15% for the health insurance? So I just plugged it so we could kind of get a little
And
bit
that's only for
better.
this coming year.
Yeah, just for 26.
I have a good question, I'm sorry. What else is in computer network, the 250? Because the detail, I only come up to like 97, it's 114, so I was wondering if there's anything else in there.
There's extra to buy, computer replacements
Okay,
if need be.
that line.
Yep. And then also in this is Kyle, who is a part of the DPW, who is a member in the DPW union. And this year we do have 3 union contracts that will go on the ballot. And his, he's the only union contract that we have, kind of came to an agreement on. So his wages are reflected in there. So I won't see any changes in as far as wages there. When you move on to PD and fire, we have not come to agreement on wages and cost items there. So you probably won't see wages for them, so. And then we talked about the encumbrances. Otis, I still need to get a number on, which hopefully you can poke them some more to get clarification on their proposal for adding in PD.
As far as the Otis, as far as getting everything, what we're trying to do is when they built the PD, a lot of different vendors were used, that we don't use in the other buildings. So our whole program here is to get that on the same wire. So for our cost savings and also, just to be able to call up, say you need a plumber, boom, you got it, they know the building. For example, this year that we realized that the service of the furnaces over at the PD hadn't been serviced since they were new. And we took care of that. We had actually the vendor that installed them, Chadwick's, came in, completely serviced them. There's 2 furnaces, so that's been taken care of. We're working on trying to wrap everything up and get a standard SOP going for everything. So elevator included.
Travis, I know you're looking at trying to cut costs and, and reduce. One thing to consider is this was one budget where we did a lot of encumbrances. So when we get to December and I look at where we are, finalizing our budget and what invoices we need to pay, a lot of those, unspent for those encumbrances in red, I will bring to you guys and say, okay, we can encumber these forward for next year. And then I would recommend that we reduce the budget here, because you're gonna use it in your encumbrance instead of the budget, so that may be a way for us
Will we already
to.
be past our time with the budget by then?
You can always change it and then bring it forward to the budget committee before at least the last public hearing. But I would at least know that by November, we pay December's bills, correct-ish, so. It may be past your time, but you can always review it, and I don't think you would probably say no to encumbering and reducing the budget, but maybe you would, I don't know.
We're what we can.
Any other questions? On these status rule?
Can you explain 210? Why it went down so much? I don't quite, the Patrick's, work cell, long distance. First light.
So for the life of me, I can't figure out why pre-me that was always at 25. I have to think that maybe they budgeted for either a project in the past or something else was included that maybe that was way before my time, that 25 was there. And then since we got into default, that number just kept staying at 25, and you'll see that we have tried to keep getting it down.
Yeah.
Because we don't use that much, so I honestly don't know why that was at 25 before my time. But we have been trying to reduce it, and we just keep getting the default, which is the $25,000, so.
It was 2023 approved, yeah, I see that.
Yeah.
Cause they requested, but the actual 2024 is 10.
Yeah, I don't know.
Yeah, it hasn't even come close. Yeah. So because we're on a default budget, we have to use the numbers, schedule, we have to use those numbers back then. So,
Okay,
yeah,
yeah.
but obviously, we can't change that. Mhm.
And then the number that you see for the requested there, Sunny, is kind of trending, looking at the, how much we spend monthly.
That will be encumbrance. That line.
Yeah, we're just monthly out of to pay the telephone bills.
The things that were increased in the last 2 years couldn't be increased. Right?
Yeah,
Any other further questions, Travis? Any questions? You're good? Karen? Good. John? Okay. Let's move on to the next one. Yeah, any more, son?
no, I'm good.
You're good. Sure.
How would you like to do, approving the budgets as they're going to be amended again because they don't have final numbers for you? So do you want to do it as presented today, or do you want to just do it when I come back with a final revised number?
I prefer to wait till we have a final revised number. I just think there's a lot of motions that are made that are kind of,
It's gonna change again.
it's gonna change again. So we've reviewed this, but I think if we can wait, that's my,
I would agree with that.
Okay.
okay. I mean, we're not.
Unless I give you a budget that I know I don't see any changes, then yes, you can feel free to vote on those. And then when I come to any of the amended ones, we can do a packet.
I think there's enough questions in regards to this, that we should just.
Wait, okay.
Wait.
Thank you, Ward.
All right, thank you, guys.
Thank you, guys.
Okay.
Now the good ones.
So you can say that there may be changes to.
Yes, health, dental, and elevator.
And possibly 210, 220, 224, 360, and then 25. Those are just things.
That we can at least kind of keep track of, we've already looked at everything else, we don't need to reopen,
Right.
we'll just look at what's changed.
Rules. Unless somebody has a question about something, they thought about it.
Yes.
And sometimes that's
Yeah,
another reason why not to do that, so that, okay.
Yeah, if you come back to things that you think you might want to address or change.
Yep. Yep. Okay. Health agencies. Next on the agenda.
We do have one request from someone who's participating online to go first. It is Shauna, right? Is it Shauna from New Beginnings? She has a 4 o'clock meeting. So
Okay,
I'd like to entertain her going first. I'll have her,
that is fine, we can do that.
and then we can take it however you want to either go straight down the line, or if you want to do everyone on Zoom, and then the people in the room, it's up to you guys. Shauna, you have the floor.
Awesome. Thank you so much. Thank you all for accommodating my request. I have to pick my kindergartner up, so I appreciate your flexibility. And thank you again for your consideration of our funding request for this year. My name is Shauna Foster, and I'm the Executive Director of New Beginnings. We are your local domestic violence and sexual assault crisis center. We're the only specialty agency providing these services to the town of Belmont and to Belknap County. We've been doing this work for over 30 years, and we are one of 12 member programs of the New Hampshire Coalition Against Domestic and Sexual Violence. Our services are confidential, non-judgmental, and free of charge. Trained advocates are available 24/7. We have a partnership with Belmont PD on a program called the Lethality Assessment Program, which is an evidence-based program designed to reduce the rate of domestic violence homicides. So we are on call to them 24/7 for that partnership. We also provide 24-hour response to hospitals for forensic evidence collection exams, as well as for general support to patients presenting in the emergency department. We offer a 24-hour support line. court accompaniment, accompaniment to the Child Advocacy Center, support groups for children, teens, and adults, prevention education programs in schools for students pre-K through 12th grade, as well as at the community college, general peer support and counseling, emergency shelter, and transitional housing. Last year, our advocates provided 284 services to 39 individual Belmont residents. Those residents ranged in age from 4 to 80. The services included court accompaniment for stalking and domestic violence cases, and that included assistance filing for a stalking protective order, as well as a domestic violence restraining order, and then assistance throughout that process right through the final hearing. Crisis counseling and safety planning, personal advocacy and accompaniment, and financial assistance, which totaled $443.75. That included an emergency hotel voucher, gas voucher, and a car repair. We don't require anyone that we serve to disclose their location, so we very likely served more residents of Belmont than what I'm able to accurately report. Our funds from the town support a portion of personnel costs, general shelter maintenance and occupancy, those emergency assistance expenses to your residents, and a portion of professional fees, including our accounting work and our annual review of our financial statements. This year, we are requesting $1,418 to continue this important work. And I appreciate your consideration, and I'd be happy to answer any questions that you have.
That's my only question is that I have, you cannot tell us how many people you have, directly worked with that are Belmont residents, is what I understood.
I can tell you that we have 39 confirmed Belmont residents last year. We served 837 individuals total. About 100 of those individuals declined to tell us what town they were currently in or what town they were from. So 39 for sure. I would bet that that number includes a few people who were not comfortable disclosing their town of residence to us. Those are often crisis line calls, sort of one-off requests for assistance or direction in how to move forward. And sometimes we serve prominent members of the community who want to remain totally anonymous, just for their own privacy. So that's where that gap happens.
Okay. Thank you.
Thank you.
Questions? Yes, Travis.
You referenced a dollar amount, I didn't hear what you said that was. What was that about and how much was that?
Yep, last year that was $443.75.
Any other questions? All right, I'm hearing no one else has any other questions. We appreciate it. Thank you so much.
Thank you so much.
What would you like us to do?
That is up to you, if you want to just go straight down the line, or do you want to, does that make it easier?
We can start at the top.
Okay, we'll start at the top.
Once we went, I don't know if we want to do that again.
What's that?
Last year in the minutes, it looked like you approved each one as we went rather than one big one at the end.
Well,
So I don't know if you want to just.
Well,
wait.
I would kind of like to be able to give us the opportunity to have a conversation with Donna. And she is en route, unfortunately, due to a health issue. She will be here later. But I would like us to be able to have a conversation with her before. That's my feeling.
Yeah, we can have everyone present, and then you don't have to make a motion right now. We can wait for Donna to come, and then we can, bring it up for discussion.
Yeah. If you don't mind.
Want to wait for Donna, or do you want to? Okay, so the first one on the list is South Road Cemetery.
You want me to speak? South Road Cemetery is again, the association allows the town of Belmont to use that as the town cemetery. By law, each town has to have some connection with the cemetery for burials. And again, they have not changed their amount, for 2 or 3 years. And they are again asking for the, $8,500. And, I can assure you that the expenses to maintain the cemetery have increased, but we have tried desperately to, absorb that through sales and through, donations. So that's not changing, that request. Any questions? No questions. Granite V&A. Julie's. Julie's.
Sure. So thank you for having me and giving me the opportunity. My name's Andy Morse. I work for Granite V&A. I am the Director of Communication and I'm pinch hitting today, so.
Okay. Join the group.
So for those of you who don't know, we're a home health and hospice agency. We've been around since 1899. Concord Regional V&A merged with Central New Hampshire V&A and Hospice in 2021, and today we serve 72 communities in New Hampshire, ranging from as far south as Manchester to as far north as Tamworth. So we provide home health or home care, hospice. We have a hospice house in Concord that anyone can be admitted to. We also have a community wellness program where we provide, flu clinics, wellness presentations. It's for people of all ages, but mainly older adults, and to help them maintain their independence and their quality of life, or even regain their independence too. We see pediatric patients. We provide babies' first homecoming visits to help new mothers and newborns transition from the hospital to home. Bereavement services for loved ones of patients who have passed, and actually they don't have to be on our hospice service to receive this service as well. So in the last fiscal year that we served Belmont residents, we provided services for home health and hospice services to roughly 240 patients in town. We also, we also provided roughly 60 people with community wellness service as well. And let's see if I'm missing anything. I think the handout that you were mailed kind of broke down all the services provided. Those costs to Granite V&A on the far right-hand column. That includes salary, benefits, medication, supplies, and transportation. So we are respectfully requesting level funding from last year, which was $11,000.
Any questions? Travis?
You give me last call again?
Give you last call. Okay, Sharon, do you have any questions? Is Granite V&A a nonprofit?
Yes, thank you. We're a not-for-profit, community-based organization. We have offices in Concord, Laconia, and Wolfboro.
So my question is about this handout. I don't know, do you have a copy of it?
I do.
The numbers?
Yeah.
So when you go down to cost to the Granite V&A, the numbers that are highlighted, is that like the cost for each section?
It is, yeah. It's the total for each section.
So this down here, the total, where it says total at the bottom, that number is not all of these numbers added together.
It should be the bolded numbers added together. I'm not a mathematician, hopefully it's right.
No. Hey, Travis, last call.
Can I interrupt before? I just realized that my 23 approved number, because we had some additions of health agencies over the year, when I copied and pasted it, it messed up, so I'm just, realizing that the numbers are very, just what they requested seems off, and then in the, default, some of the numbers kind of shift. So if you're looking at some of their requests or the approved in the past, and like way higher than they are, it's because I just transposed the number wrong, because we had addition since 23.
Okay. Travis?
Question I have is, so it's, you talk about services that aren't covered by insurance. Do you roughly know how is Belmont higher and not covered with insurance? Do we have a lot of insurance for our residents that use your care?
I don't believe so now. And I know in the fiscal that we're looking at, we did not provide any free or subsidized care to Belmont residents. I can tell you that much.
Wait, can you say that again?
So in the fiscal year that we're looking at right here,
Yeah.
we did not provide free or subsidized care to Belmont residents. So like for charitable care.
Any other questions? Okay. Thank you.
Great, thank you.
I think we ought
Oh,
I think we ought to change that figure from 7,500 to 5,000
Where
on that, on BNA.
you're at the.
You're the, no,
you're-
granite, we're on granite.
We're on granite.
One up above.
But are we doing, we're gonna discuss
Yeah,
figures at the end,
sorry.
right?
Sorry about that.
okay.
We'll discuss those figures at the end.
When we go, if I feel like it.
Oh, all right, we'll go. So do you want to change that? figure?
No, that's all right. We'll go.
All right, thank you.
All right, thank you.
Okay, the next one is Lakes Region BNA.
Thank you so much for having us, and for your consideration of our request. My name is Dr. Erin Joss.
I ask you to speak up, please.
Oh.
Sure, now that-
Sure. I'm Dr. Erin Jospy. I have the privilege of serving as the Chief Executive Officer of Lakes Region VNA, and I'm joined today by my friend and colleague, Jim Harnett, who serves as our Chief Finance Officer. So Lakes Region VNA, just for some context, has been around for over 100 years now, serving the Lakes region. We are a nonprofit, community-based organization whose mission is truly dedicated to the health and wellness of our entire population, ranging in ages of care from infant all the way through to the geriatric population. Like our colleagues at Granite, we provide home care, hospice, bereavement, social work, chaplaincy, as well as maternal and child care, as well as hospice services. So we really run the gamut, trying to meet people where they are. In terms of community wellness and investment in the communities which we serve, we really look to have support in providing community education. How do we keep people healthy and well in their homes? We also support graduating high school seniors who are pursuing careers in the clinical arts. This year, we were very privileged to give one of our $1,500 scholarships to a Belmont graduating high school senior. And lastly, we too have significant charitable care needs. The rates of reimbursement for home care especially continue to drop. And we look to have support in trying to close those gaps. This year, we provided 3 times the amount of charitable care that we provided the year prior, and we expect that number to only increase. So I'm joined today by Jim, and I'll let you
Sure.
again speak to our finances and
Sure.
questions that you need.
Right. Thank you. Lakes Region DNA, we respectfully request town appropriation of $7,500 for 2026 calendar year. And this will help us support our home-based healthcare and community wellness services for Belmont residents. We thank you for your past support and respectfully ask for your partnership again in 2026 to ensure all residents, regardless of financial circumstances, have access to compassionate and professional home-based care. Over the past 12 months, Lakes Region VNA provided a total of over 1,400 in-home visits to Belmont residents, including over 600 skilled nursing visits, which is almost double from our prior fiscal year. LRVNA is proud to be part of the Belmont community. We currently employ 4 full-time Belmont residents, and we're committed, as Erin had mentioned, we're committed to supporting local students who are pursuing careers in healthcare. Each year we award scholarships to 4 area high school students, and including this year we had one in the Belmont high school system. We're pleased to take part in Belmont Old Home Day in August, and you had amazing pancakes, by the way. Looking ahead, we're excited to continue our involvement with upcoming events, including a food clinic that we're hosting here in this building on October 24th, as well as a coping with grief during the holidays discussion that we're having in November at the Belmont Library. We remain steadfast in our mission to provide compassionate, high-quality healthcare and hospice services to all individuals, regardless of financial circumstances. And your continued support makes this possible. We're deeply grateful for the trust you place in us, for your community.
Awesome, thank you. Do we have any questions? Yes, Travis?
I heard the amount of visits. You know roughly how many residents you interact with in Belmont for hospice or in healthcare?
It would have been roughly 600 plus. Yeah, with that many visits.
Any questions?
I have a question, but I was wondering too, can I also address it to the gentleman from Granite State? Because I'd like an answer from his agency too.
All right.
So one of the experiences I had in my life was I had a child with a chronic illness. And the VNA that was there at the time, she was a pediatric. They had special services that parents could utilize to help them adjust to their child's needs. Is this something that you agencies do?
So we have recently built out our service line around maternal child care. Specifically, that goes to really addressing the maternity desert that we're experiencing more and more. So, for example, as a former maternal fetal medicine patient, I was on bed rest. To be able to have your nurse come to you instead of driving for an hour to go and have a blood pressure check and a urine dip, that is a service that we can provide. For infants, which is really our focus, Selectmen Champion, more than older children in that pediatric and adolescent population who may have some additional special needs. We're really looking at weight checks, making sure that people are on the those children are on the appropriate developmental pathway. Bilirubin checks. So newborns that are experiencing jaundice, we have the capabilities to bring those devices into the homes. And we're working with several local pediatricians and family docs to expand those services accordingly based on what the need is. We're really looking for that feedback on community need to make sure that we're meeting people where they are. But I think one of the challenges in providing that service line is attracting and retaining staff who have that skill set that's necessary. We really lucked into having a wonderful home care manager who herself was an obstetric nurse for many, many years and is still very much a part of that community as a lactation consultant. And so those are the services now that we're really able to invest in and continue to offer. Does that answer your question?
Yes.
If I may, sorry, Selectman O'Hara, I think I misspoke. You asked how many patients.
Yes.
I think it's 600. That was the number of visits.
Visits.
So yes, that would have been more around the 60 to 70.
Thank you.
Yeah, thank you.
My question too is how many Belmont residents have you served? It looks like in 23, you did maybe 71. How many?
I was going to roughly 71 to 80. Yeah, depending on, so 600 visits, it would reflect that number, about 70 to 85.
Questions?
Yeah, I got the same question as Granite VNA. Are you guys seeing an increase, decrease of residents with insurance that are able to cover these types of costs?
So I can't answer specifically to Belmont. We can get back to that answer in terms of how many have needed charitable care specifically. I can only speak to across our catchment area, how much charitable care we've provided. We are anticipating an increased need given the changes that we're seeing at the CMS level. So more people are losing their insurance, and the people who have insurance have still increased out-of-pocket expenses that they're not going to be able to meet. So we're anticipating a 5% minimum decrease in our reimbursement rate. Though my understanding is that CMS is actually entitled to a fairly substantial cut, far more than that. They already have congressional approval, so we'll see whether or not they execute.
And that's
on it.
today.
That's today. That doesn't
Right.
reflect what
It
happened
could
in
change, it
January.
could change in a month.
For
it could
sure.
change in 2 months.
Correct.
And that's the hard part that all of us
Yeah.
as nonprofit healthcare agencies are confronting. It's a rapidly shifting landscape. And as you know, hope is not a strategy. So we very much appreciate the support. And we hope that you see it as a reflection of our partnership and commitment to that partnership as well.
Awesome. Yes. Thank you. Any other questions? No. Thank you very much.
you.
Ryan? Yeah.
I'll brief if I may. I just wanted to ask, Granite DNA. Your request last year and the years before have always been 22,000, and then this year was 11. Can you explain the decrease? I know what I think it might be, but.
Yeah, correct. We've actually refocused, and we wanted to ask for the same amount that we were granted this past year. The exact, I don't know the exact reason, but that's what we went with.
Okay.
Yeah.
That's what I figured. You
Yeah.
Went with just what we gave you.
Yeah.
And that was only due to the default.
Right.
The next one is CASA.
Community action.
Oh, is that? I'm sorry. Oh, I'm sorry. I'm, sorry, community action. Community action. Sorry about that.
CASA's great too. So.
Yeah. Well, see.
Right. Right. Thank you so much. First of all, for your continued support. You guys have supported us for years and years and years, and it's just really, really appreciated. It makes it easier for us to do our work, especially in this time where, you know, we're hoping that we get to keep our funding. So, just thank you very much. This year, we are asking for 15,000, which is the same that we asked for last year. In front of you, you'll see kind of summaries of services. And this is the second year in a row that we have provided like the full community action services to you guys, except for transportation and family planning. And family planning you guys received last year. We no longer are doing family planning. That is a program that has funding was not received. So that as of September 30th, community action is no longer doing family planning. So we're trying to be more transparent and show people all of the services that we're providing for every town in our catchment area. So as you will see, total services was $881,160.01 last year for Belmont residents. 1,027 people served. Households are 687. That looks weird. Households are always wonky because some programs only give us households. Some programs give us households and individuals, and some programs give us individuals. And that is based on how they are asked to report to whatever funding source they have. So we don't have control over that. So I like to put that out there that it may look funny because of that reason only. And so I'm here to answer any questions.
So the 11,922 meals, is that strictly the Meals on Wheels?
Nope, that would be Meals on Wheels. That would be summer food if you guys received any, which doesn't look like you did. And that would also be community dining. So congregate meals in our senior centers.
Okay.
Yep.
And you have no way of knowing how many Belmont residents are in those situations where they're receiving meals.
So yep. If you look at community dining, for community dining, it was 2,373 meals to Belmont residents. And then if you look at Meals on Wheels, which is right in front of me, 8,302 meals. We did try to break it down for each program.
$1 million question. I know that you're accepting applications for fuel assistance.
Yep.
But you don't have do you have a number? I mean, do you have an amount that you're going to be able to have available for fuel assistance?
As of right now, it is the status quo and same as last year. And we have not heard anything else from the state, from the feds to say anything different. That is the last update we got, is that we should be good this year with fuel assistance. That being said, that's today.
There we go.
And we will keep you posted as we understand.
You say we compare against other communities that you serve, like if you had to rank who receives the most services, and is that a metric you have and
Yeah.
you give out?
Yeah, I can't tell you exact numbers, but I am looking at this information a lot right now because I'm doing a lot of these meetings. And I will say Belmont, I mean, obviously Franklin, Concord and Laconia are our 3 because they're the cities. And Belmont is the next highest out of the rest of the towns, I believe, either 3rd or 4th. Don't quote me, but yes, it's one of the higher ones. The need is there. And I can give you the exact amount. I have it.
No, I mean, it'd be cool to throw in as like a percentage or a slide just to see, if, you know, are we the lowest on the totem pole, or are we the highest? It sounds like maybe we're the highest, or not the highest, but in the top 5.
Questions? Yes.
What's this permanent supportive housing?
Yeah, so PSH is a permanent housing, so it's basically you apply, it's income-based, that is determines whether you're eligible or not. And it goes on your income, so whatever you make will determine how much you pay of your rent and how much the program pays of your rent. And we have, for both Merrimack and Belknap County, we have 8 households in that program. And that program is permanent, so there is no end date for that program. Usually people go into that program who are waiting to get their housing voucher. It's one of those like step 2 programs. But what was happening is that people were never getting their housing voucher and then falling off of this program. So they've allowed us to keep people on this program longer. And so you guys had one of those households. Yeah. And then housing stabilization, very similar. That is not a long-term, that is a more short-term. So someone comes to us and says, hey, I'm 1 month behind rent. Or maybe someone says, hey, I'm 3 months behind rent. We can pay one. I'd call Donna and say, hey, like, what can we do? That is really to make it the stopgap so that we aren't seeing more people evicted. It's not long-term.
And where are these people being housed?
All over the place. I mean, we have, yeah, I mean, we have built up a really good landlord base. And now we have some landlords that don't post their units. They come to us because they know that we will be able to get someone that fits that exact apartment.
Are apartments becoming any easier?
No. We've just done a lot of work around that. So we've been able to, it's been a little easier for us, but that's because we put that effort in to make sure those landlords, when there's an issue, they're not calling the police, they're calling us. And we are helping work through whatever that issue is. And that has really helped us.
To be able to get the.
Yes. And that's not part of the program. Like there's no money for like the staff time that it takes to like literally hang the phone up and drive to the apartment complex to mediate that kind of stuff. So we're doing those types of things and it's helping with people staying in units, 1, and not getting evicted for lease violations or whatever. And 2, for the landlord to pick the phone up and say, hey guys, I got a unit. Yeah.
And I know you do work fairly closely with Donna.
Very. She's probably sick of us.
It's. Any other questions from you?
I have one.
Yes.
The Head Start program,
Yes.
is this the preschool or the daycare?
So Head Start, that is the preschool. Yeah, so Head Start is 4 and like 3, 4, and right before kindergarten. Yep.
Any other questions?
I got one last one. Do you guys do any work with the police when it comes to like the encampment stuff and getting people out of them?
And that's something that we don't really get to like show you because that program, we get money for that program, right? But that's all staff. So there's no like, hey, we touched 15 Belmont residents and it was this much money, because that doesn't exist. There's no like way to compare that. But yes, we have boots on the ground in every community in our 2 counties. Ashina Miller is our boots on the ground here in Belknap County. She was actually supposed to be with me today to answer questions, but she's sick, unfortunately, like everyone else, I feel like right now. So yes, we are boots on the ground. We do encampment twice a week. If we work with all the local welfare, to help get documents, do all of that. So yeah, we are doing a ton of that. We work with state police, we work with local. So if there's gonna be an encampment that's on state property or even on town property, we work very closely with the PD to make sure that we know about it. We can tell people, give people time. We can be there when it happens to help if things need to be moved, so that they're not just picking up one thing and leaving a bunch of the trash. We try really hard to help with that. And we've seen some improvement with having those relationships with the police departments and with the state police to say, hey, just let us know, because it's gonna make everyone's life easier and that transition easier. So yeah, we're doing a lot of work. Unfortunately, when one is swept, another pops up, or, we.
To the other town next door.
Right, or we
I
get.
was just gonna say, they just moved from one time. So how do you know, well, I mean, obviously, if 1 week they're camping in Laconia and the next week they're camping in Belmont, I guess they're camping in Belmont, they're a Belmont resident for that week, because the week before they were a
Yeah.
Laconia resident, because they were in Laconia.
And that's why, again, why that program's so difficult, because I could pull someone up in that program and they could have 10 different touches in 1 month and live in 5 places, be in 5 different towns. So there's no way to say, hey, Belmont, you have, because at any given moment, you could have 0, you could have 50, so.
Any other questions?
I don't have a question, but I don't know if the number was stated out loud to those listening, but so here you have stated that there's roughly $881,000, almost $1 million of services that were given to Belmont residents only.
Yep.
So when we're comparing, these services minus things like weatherization, because the town and our welfare wouldn't deal with weatherization and or Head Start or early Head Start, and maybe not maybe just those funds. So if you were to kind of think about that 881,000, maybe something that the town of Belmont would have to pay for. And then when you compare that to your small ask of $15,000, I think you can see that we're, the 15 versus the almost $1 million that this program has given to residents, I think is a good trade-off.
And we're expecting next year to have a pretty, like, with fuel assistance alone, the increase already, and we're only in October. They have already done more than they did last year at this time, more applications. So.
Gonna be my next question.
Yeah, more for fuel assistance, I know that, and for food pantries, we're seeing an increase, and we're seeing an increase in, elderly population, and we're seeing an increase of people we've never seen before. That's a new thing. People are coming to us that we've never seen their name. They don't know any, they're, hey, I need help, and we're walking them through like what to do. And
I know that last Monday, for the amount of time that the St. Joseph's food pantries were open, they saw over 60 people.
yeah, it's
And
incredible.
that is increasing on a weekly basis. And I know, what's today? I visited Monday afternoon, the people that volunteered there before they closed, and they were exhausted. And this was the Friday before that they saw the people. I didn't even ask how many they saw on Monday. They never stopped.
Yeah.
And this was basically St. Joseph's, it's Belmont, and it could be Northfield, Canterbury, but most of the residents were Belmont, and yeah, it's increasing huge, and it's not even cold yet.
Right, that's the, and so you'll see TFAP, which is the emergency food. That food is given to like the Belmont food pantry, right? We provide that food. But then our emergency food pantry, that's Laconia. So people are coming to Laconia, and honestly, someone can go to Belmont and come to Laconia if they need that food they're allowed to do that, and we are seeing kind of more of an increase in that as well.
Yeah. I have a hard time sitting there and seeing kids, little kids coming. Yeah. Awesome. Any other questions? Thank you so much.
Thank you.
Now, Casa.
Yes.
Casa? Casa or
We have
Casa?
a Casa rep in person or online?
Who is there?
Looks like they're gone.
Okay, so we'll just go with what we have for information then. Okay, waypoints.
Hi there.
Well, waypoints. Awesome.
On the screen. Nice to meet you all. My name's Laura Zorowitz. I'm the director of philanthropy at Waypoint. Can you hear me okay? I know sometimes it's hard over the video.
We got a new speaker this year, so we can hear you loud and clear.
Awesome. I just wanted to check. So Waypoint is really grateful to be able to come back in front of the group and ask for funding again this year, respectfully. And as most of you probably know, but I'll just review, Waypoint, we're a statewide nonprofit organization. We provide social services to over 8,000 individuals over the course of the year throughout the state. But in Belmont in particular, we provide service in two areas. One is healthcare coordination. So this helps children up to the age of 21 who have chronic health conditions navigate healthcare and support their families. And some of our caseworkers are actually with these families for 21 years, helping them coordinate their healthcare needs in the system. And in Belmont, we have served 12 clients and their families in the last year through healthcare coordination and also through some community-based voluntary services. We call that CBVS. So these services are provided when a family has a case with DCYF that is closed and they still could benefit greatly from services in the home. It is voluntary, but we provide wraparound services and support, helping families navigate parenting challenges, financial struggles, and finding resources in the community. So last year we had asked for 4,000 and we received a little bit less than that, but we would like to come back and ask for 4,000 respectfully again this year because there are so many financial challenges right now. The cost of providing some of these programs is definitely increasing. And so we really appreciate your consideration of this. I'm happy to answer any questions.
Questions?
Yeah.
Maya? Okay. No? No? No questions? So are you, did I understand that you said you serviced 12 families in Belmont?
Yes, 12 in the last year. And these are like two different levels of care. So one is the continuous healthcare coordination, where one of our caseworkers works with families year over year when their needs are higher. So some of this has been an ongoing relationships. Some of them are the client-based or the community-based voluntary services. So that is on a 6-month program. So those families would have been worked with for 6 months throughout the course of the last year.
Awesome. Okay, any questions? Nice chance. He's good. All right, we have no questions, I guess.
Okay,
Awesome.
Thanks so much for your time.
We've already done the beginnings. American Red Cross.
They replied to me today and said that they are basically short-staffed and short-volunteered and they're unable to send anybody, but
We have no information.
information that they provided to us.
All right.
They've been one of our agencies for a while.
Okay. Lakes Region Mental Health. No, it doesn't work.
Oh,
Yeah,
okay.
I gotta, all right, I'll just talk loud.
So-
Can everyone hear me?
Everyone listening.
Okay. I'm Beth Vashon. I'm the Chief Development and Public Relations Officer at Lakes Region Mental Health Center. And you probably all already know much of what I'm going to say, but just in case you don't. We're a private nonprofit founded in 1966. We're going to be celebrating our 60th birthday this upcoming year. And we're one of 10 New Hampshire designated community mental health centers in the state. We serve 24 towns in this area, including all of Belmont County and Southern Grafton, and Belmont being one of those towns. Per our contract with the Department of Health and Human Services, we provide services to anyone seeking behavioral services, mental health services, regardless of their ability to pay or whether they eventually become a patient in the future. So one example of that is if someone accesses services through our emergency services or rapid response, we may not see them again. We deploy to even other catchments at times. It depends on where the call comes from. And the contract with the state also requires us to provide services to the most vulnerable people in communities who require the highest level of care. They're high acuity cases oftentimes, and they're the furthest from socioeconomic opportunity. And our budget is comprised 70%, it hovers around 70% of Medicaid reimbursement. And the other 30% is dependent on private insurance, patient co-pays, patient self-pay, which is rare. And other sources of revenue, including town and county support, grants, donations, and other fundraising activities. I'm hearing from many of our other nonprofits. We're in the same situation, as well as with your town. And there are high costs associated with maintaining our staffing and our services per our contract. We're required to have a chief medical officer who's a medical doctor that oversees the prescribing of psychotropic medications. We have a child psychiatrist and psychiatric mental health nurse practitioners. All of those we're required to have so that people can receive the type of care that. Do you have those? Oh, yes, yeah.
Just ask it.
Yeah, yep. Yes, so we have one child psychologist, one chief medical officer, and currently 6 prescribers. And I'll get into that. We have an ever shifting workforce. Yeah, so in addition to providing those comprehensive integrated services, including emergency services, 24 hours a day, 7 days a week, we're committed to leading the effort to achieve Mission Zero, which is to eliminate emergency room boarding in our state. Last year, we opened a Place to Go in Plymouth, which is one of 2 new centers. One operates in the southern part of the state. To offer people in the middle of a mental health crisis a place to go. It's in the name. For short-term stabilization and resources. The doorway is conveniently located right on our Plymouth campus as well. And because we're the northernmost location, we can take referred patients from all the way north. In the application, I provided you so many links to our other services in case you were curious, because I could probably be here for a day describing each of them, but we don't have that kind of time, do we? So in case you were curious, I provided links where you can go and read about more of our services. But so last year we implemented a Place to Go. Our adult services team collaborated with the Belmont County Court and the judicial system to establish Belknap County Behavioral Health Court, which is now up and running. that's to divert low-risk individuals from the court system and into appropriate treatment. And we also opened our doors in Laconia 2 mornings per week for open access, which is walk-in intake assessment for adults 18 years and over, people who need immediate care, and we can eliminate wait lists that way. And we have seen an increase in services through that service. You've been talking about street outreach. I also talked in the application about, we do have a grant through SAMHSA and the Department of Health and Human Services, federally, to provide street outreach and services for homeless individuals with co-occurring mental illness and substance misuse disorders. And anecdotally, we're seeing an increase in Belmont residents that we're treating. We have seen sort of a migration into Belmont. I don't have the data yet, but our grant requires us to reach at least 200 individuals in the catchment over the course of the grant year. So all this was achieved last year during a really complex budget and legislative year, and one which we lost quite a number of staff due to, we had an existing workforce crisis, but a lot of people took that instability and went to private practice, unfortunately. So we've gone from a high of 205 employees to currently 173. And because this budget year is so uncertain, I'll give you an example. Our CEO is doing she's filling 3 positions, right? Pretty key positions right now. And that we're all kind of doing, because we don't know what the increase in our health insurance premiums will be. We expect about 10%, just like I heard mentioned here. We don't know how many of our patients will lose their Medicaid benefits, or how much more charity care that we'll need to provide for those who can't afford any copays or increases in copays, and they're part of the cost. So this year's request is an increase over last year, but it really reflects the need, and it's for $19,921, which really represents the percentage of the Belmont population which hasn't changed, by the way. I did look at that. Still 8% from the last census. And our budget for access to care. And that is a non-revenue producing program. So it's just out-of-pocket administrative expenses. And that budget is a little over 249,000. So last year, I do have a correction to make in the application. I got data after I submitted it, but we served overall 3,088 patients in our entire catchment area, and provided a little over $826,000 in charity or uncompensated care for people who cannot afford to pay for their services. And Belmont specifically, we serve 251 residents of Belmont. And from this point on, I'm hoping to provide you with service hours. You'll see that in the table in the application, rather than, it just gives a more accurate picture of sort of the acuity of need. I think I spoke to you last year about we're continuing to see an increase in the number of children specifically, and this year in elders. So we served 3 more residents of Belmont than we did the prior year. But you can see that the adults 18 to 61 years decreased, and there was increases in children 0 to 17 and elders 62 and over. Not much we can do without getting into patient records to draw conclusions from that, but you might be able to draw conclusions from the number of service hours. So the shorter service hour terms could indicate a need to access emergency services, for example. People who have more service hours, might be participating in our supported employment, case management, those type of longer term maintenance services. I think that's about it, unless you have questions. I think last year we received the default amount. But I think it was 5,000 and the year before was 7,500. So unless I have that wrong, yeah, okay.
They did additional cuts after
Okay.
the default, so
Okay.
I think they pretty much took half of what the defaults were for everybody across the board.
Yes. And we provided 63,000, over 63,000 in charity care to Belmont residents. So our request is less than a third of that, so.
Any questions? Sharon? Travis?
A lot of information back there, just to thank you.
Great, thank you very much.
Okay, Franklin VNA.
They're not-
You can have to
Yeah.
Sherry, right?
Sherry
Yeah,
Murray.
Hi, everyone. My name is Sherry Murray. I am the Executive Assistant HR Coordinator at Franklin VNA and Hospice. I also have on Kristen Albert, who is our CEO and a resident of Belmont, and Nicholas Johnson, who is our CFO, in case you guys have questions that I might not be able to answer. So we are a small home health and hospice agency located in Franklin. We have just the one location. We service individuals in 14 towns in the Belknap and Merrimack County. 1/5 of our visits come from patients in Belmont. So like I said, we provide home health, which is your short-term skilled hospice, and private duty services, which is our homemaker program, which allows us to see homebound individuals and help them remain safely in their home. So we're able to, if they're homebound, go and pick up their groceries, go to the laundromat for them, pick up their prescriptions, in that type of thing. For the last fiscal year, we provided $20,000 in charitable care to the residents of Belmont. Of that, we provided 862 visits to 105 patients when considered the patients that we see in our community health clinic. We go to 3 different locations in Belmont every month for community health clinics. They are Great Brook, Mallard's Landing, and Briarcrest. We also provide education to staff as needed in those locations as requested. We are respectfully asking for $4,000, which is what our funding was a few years ago before the budget cuts. The residents we're seeing in Belmont are increasing. We're getting more hospice patients year after year, which is requiring more care. So even though we only provided 862 visits for the 105 patients, a good chunk of them are hospice visits, which run a couple hours each. 8 of our 41 employees are residents of Belmont. We also offer community health clinics in our office that anybody can come to. So we get residents of Belmont that come to our monthly walk-in grief support group. We also have a dementia support group for families, along with our community health foot clinics that run on Wednesdays. What kind of questions does everybody have for me? We also attend all the Belmont town festivals. So we go to the trunk or treat. We do participate in the Belmont Old Home Day. Anytime Belmont's hosting something, we try to be known and go to support the community.
Any questions? Travis?
I just want to make sure I had the number. You said it was about $20,000 in charitable care.
That is correct, just to the residents of Belmont. Our charitable care in 2024 was $189,669. And 20,000 of that was just unreimbursable care to residents of Belmont, never mind the community health clinics and things of that nature.
Thank you.
Any other questions? Guess not. Thank you so much.
Thank you, everyone.
Yeah,
Thank you.
Partnership for Public Health.
Hello, thank you for having us today to talk to you, and thank you for your support over the years. I appreciate it. I've been here the last 5 years, except last year, and Carissa stepped in for me last year. So she's very passionate about aging and adult services. So I'm sure you all heard about that a lot from her. I am here today to talk to you about our programs. I know you have your packets. The one we usually talk about that you're very interested in is our Aging and Disability Resource Center. Used to be called Service Link. And the state has changed that to align more with the federal funding that they get for a lot of the programs that we do through the Aging and Adult Resource Centers. One thing that I do want to say before we really delve into the programs and the work that we do is that the Partnership for Public Health, most of our funding comes from federal and state and local grants and funding and some fundraising. We're not able to bill for the services that we do. They're count more support services, resource connection services, option counseling to help the aging in our community get connected to a lot of the programs and the resources here and help navigate them and navigate our complex healthcare system and insurance system that we have in this country. And so none of our work is supported by any type of insurance billing or third-party billing. So it's all from state, federal, and local grants and support. That being said, I think our Aging and Disability Resource Center, we've spelled it out since 2020, so y'all can see how many residents we consistently serve in Belmont. It was, of course, in 2020, the largest. That was during our COVID days and times, and we did a lot of vaccination clinics and supporting people in how to shelter in place in their homes and getting their services like their medications and things like that. With the isolation that we had at the time. So with the Aging and Disability Resource Center, one thing that I wanted to point out that just happened, as we know, everything is changing. Open enrollment for Medicare started on the first week of October of this year, and we usually average about 200 calls a month for our Aging and Disability Resource Center. Main phone number, people have their regular person that they deal with every year, but our main line, for new people is usually about 200 calls per month. And in the first week of open enrollment, we got 808 calls because people, a lot of our Advantage plans are changing what they're covering related to the new regulations and everything that's going to roll out in January. So people are needing assistance and trying to decide if they're going to change. Some Advantage plans have even pulled out of the state. So people need to figure out where they're going to go because these are plans that they've been on for years. So, I know we're not asking for a lot of funding, but this funding allows us to maybe let one of our part-timers work a few extra hours to take some of these calls and help some of these people. Or if we do need to pay overtime because we only have, till the first week in December to help people with their open enrollment. And so sometimes we allow a little bit of overtime to try to make sure we can get all of these people called back and taken care of, and that they have the best plans that is going to save them the most so they can hopefully plan their budgets for the rest of the year and stay as independent as possible in their homes. So I just wanted to point that out because that's our changing landscape in the past week. Also to point out, we've lost $150,000 from state and federal contract since the beginning of January, 150,000, and we just found out last week that we've lost another $165,000 in the federal government for our substance misuse and suicide prevention work that we do in the community. That a lot of that is spelled out here for things that we do in Belmont in the letter that, you know, I submitted. That is going to be, that was funding that we were told in August that we would receive. It comes from the CDC. So with a lot of the changes that happened in the CDC, this is a continuation funding. We've had year 1 through 5, and we were going for year 6 through 10. That funding, we were told they're gonna reopen the application and we have to reapply for it in November, just to make sure we are in compliance with all the new executive orders that have come out in August and July. So we will have to reapply for that funding and hopefully we will receive it. But right now it's part of the budget we were planning for that we no longer have in our budget for the coming year.
Was that 100% of your funding, Doctor?
Yeah, we do not get that funding.
You were gonna get 165, now you get 0.
Yes, now we get 0 until we reapply. And it was supposed to start October 1st and we were notified October 5th. Yes, so.
Are you hopeful that you will, when you reapply, you'll get it or no?
Yeah, we were told we received it, and so we did make it through the application process, and our application was reviewed and scored out, and we were told we were one of the higher candidates, and we're going to receive the funding. So we are hoping that that will be the case. We had already went through a lot of the executive orders and made sure that our language and everything like that was appropriate. We will go through it again before we reapply and just double check that we are following all the executive orders so that our application doesn't get kicked out. So we are hopeful we passed the first time, that we'll pass the second time. There's also some new funding that we're applying for through the Department of Justice that Senator Shaheen's office has sent us that is similar to this funding that we'll also be applying for, that only nonprofits can apply for. So universities and other places that we constantly compete with, we will be able to just apply for this funding to do the work in our local communities. So, you know, there's hope, but there's also things in reality that are dollars and cents that we have to deal with regarding our budgets and the work that we do in the community. So, that being said, I will also like point out a lot of the things that we talk about is the school-based flu clinics that we do locally, and the flu, our numbers were down last year. We think a lot of that is also people are weary of vaccines right now. So we're trying to be a little bit more proactive and positive. We've also started this year some online forms that parents can do the forms online. So we're hoping when we come to your school in October, our numbers like pick up, because we did see a decrease last year in that. So we're trying some new things to hopefully increase our numbers this year. One thing that I realized was not put on this report and will be on it next year for you all is we do also have a HRSA federal grant that we are working on. It's a mobile integrated health grant. There are 2 pieces to that grant. One is a community health worker that we are working with Concord Hospital, Laconia, and Franklin, that working with people that utilize the ER a lot for their primary care physicians because they don't have access or aren't connected to a primary care physician. So they're high utilization of the ER. And our community health worker can do all of Belknap County. And so she actually reaches out. Concord Hospital refers these patients to her. She helps hopefully them access a primary care doctor that they can go back to. She follows up, makes sure that they make it to the doctor, that they have transportation to get there. So we're trying to reduce those ER visits and that repeat, and hopefully stabilize the healthcare of those individuals that are constantly repeating back to the emergency room for the same concerns or similar concerns. That is a program. The second piece of that program is with Laconia Fire Department, where we actually have a paramedic that can go out and do some of the actual medical care in the home to the patient and kind of reverse that transportation issue where we actually go out and do some of that care. The hope is that we will eventually be able to expand the paramedic piece of it to other communities, but right now we just have the community health worker piece that are for Belmont residents. I can tell you I have meetings with the hospital and they did say they wish we had the paramedic piece in Belmont because there is, like, they see a need in this area. So it is something that we are looking into how we can make that happen in the future. But right now we do have at least a community health worker that can help navigate them to the access to healthcare that they need. That's everything that I wanted to highlight from what I sent you, and I definitely will take any questions that you may have for me.
It does seem people go to the ER, a lot of the repeat people, they go there because they know that they'll be cared for because they have no insurance. No, I hear that all the time. You know, ran into someone that I knew, on the way to the hospital because I have a sore throat. Okay.
I think that's a percentage. It's probably a smaller percentage than we think. It's probably, from what we've seen from the numbers that we've received from the hospitals, around 15 to 20% of those high utilizer patients. Some are just, I tell you, the biggest issue is transportation and people being able to get, like, if you have a specialist, you have to go all the way to Concord usually for your specialist. And if you don't have transportation, you have to catch the bus, which comes to Laconia. So you have to get to the location in Laconia where the bus comes, and then you have to take the transport bus, which takes about an hour and a half to get to Concord, to then catch a Concord city bus to get to your appointment in Concord. So it's very complex for people that don't have transportation to get the access to those specialty services that they need to get to. So we try to mitigate some of that by, how can we best, is there a way for us to get transportation elsewhere? But we also work with those patients that don't have health insurance, and we try to help connect them through our Aging and Disability Resource Center with an options counselor to try to get them options to getting connected to healthcare if we possibly can. So a lot of getting signed up for Medicaid and even some of the Affordable Care Act insurances, there's a lot of steps, a lot of hurdles that you need to go through to actually get approved for that health care. And it's very difficult for a lot of people to make it through all those hurdles and steps. And that's what we do, is we walk hand in hand and we help them. We stay on top of it. Did you get that piece of paper? Here's another number for you to try to get that piece of paper so that we can fax it in. We fax in all the paperwork for them. It's a lot of that step by step, having someone beside you, reading all those papers that you get and you can't figure out what they say, and like boiling it out. So no, you have to do step 1 and step 2, and then you're good. And you have 10 pieces of paper telling you that you need to do step 1 and step 2, and then you can get access to health care. So we help people walk through all of that with our Aging and Disability Resource Center.
Any questions? No, any questions, Sharon? No.
Okay,
No
thank you. It's
questions?
good to see you all again this
Yes.
year.
Thank you.
Thank you.
Okay, we have Family Promise of the Lakes Region. Hello there.
Good afternoon, everyone. I'm Sarah Shady. Thank you for hearing me. And I'm in a little bit of a unique situation in that we are a developing affiliate. So we have not actually provided services yet. We're trying to get the funding together to be able to launch our case management prevention and stabilization program. I think it was last year, I'm sorry, forgive me if I'm speaking. I gave a year 1 budget as well, in addition to the other budget I gave, which would include expanding and having a full staff load to be able to provide services. We're looking at providing services to 100 families in our first year. I'm estimating 10 of them to be from Belmont, but I'm sure those numbers may reflect differently next year, should you guys find us.
Since you are a new organization to us, can you just explain a little bit more about what you do and
Yes.
for the communities?
Can I give you a background of who I am and how we got here and how that goes in?
Absolutely.
Thanks. So as I mentioned, I'm Sarah Al-Sharidi, and I have 8 years ongoing of social work experience behind me, including I started in child welfare investigative services and specialized in the prevention of trafficking of minors, and I did that for about 6 years. I have since transitioned that to Mass for 3 years, where I did the housing clinic director, where we worked with those that were experiencing or at risk of homelessness, and that included families and individuals. of low to moderate income, and we would provide case management services on a one-to-one basis. We were a small group of 3. With that number, we helped 600 or more families every year. I was part of the group that expanded that from where it used to be 200 to 600. I lived in Laconia and have been living in Laconia since 2022. I noticed both online and in the community that there seemed to be an increasing number of homelessness encampments and groups and families, unfortunately mentioning things like, hey, lost everything, can you please donate X, Y, or Z? And I said, well, I've been touched a little bit about this topic. Let me see what gaps I can fill in. That led me to Family Promise National, who is my fiscal sponsor, who provides some financial oversight and advisement. We have decided to try to launch with the case management program, where we would again offer one-to-one services with a case manager. We would also have financial planning classes, employment assistance, and budgeting and things of that nature. A family would come to us and they would have a sit down with their case manager. They would come up with an action plan with that case manager of things that both the family has responsibility to follow up on and the case manager does, and they would meet week to week until all of those needs are met. That case would then close. However, case closure does not mean the family could not come back. So they could always come back for those case management services. As part of our budget, we've included direct client expenses, which would be our tenant assistance fund. This is scalable. The goal is to help with things like if you're behind on rent, a mortgage, if you need help paying for your licensure for plumbing or your hairdresser, whatever the case may be, or for classes, things like that, so we can help you get more stabilized and hopefully prevent you from getting to the street in the first place. Awesome.
Any questions, Travis?
Yeah, so you guys are separate from the Nashua, I you say have your own board and everything?
Yes.
What kind of experience or history do you have for members on your board? I helped develop Burgess House of Hope, and it kind of just fell apart because there was a lot of experience in the case field, but not a lot on the financial side of it.
Yes. So we have 9 people on our board, and we're always recruiting for more, just so you know. But we also have one of our treasurer actually does this out of state. They purchase properties, they rehab them, and they have them for affordable housing, including transient housing for families who are at risk or experiencing, domestic violence. That's one person I have on my board. I have others who, yes, have some financial aspect. There's some that provide commercial insurance. Those that have personally been experiencing homelessness or have experienced homelessness. I have someone who has some work with the, and I'm sorry, my brain just died. Spiritual, couldn't think of the word, I'm sorry, like chaplain, sorry. And I have others who have also worked at nonprofits to provide this piece of the financial aspect of helping set up the budgets and expenses and so on as well.
Good. Any other questions? No? Okay, thank you so much.
Thank you, guys.
Okay, our last one is Health First.
Well, hi, everyone. I'm Ted Boliani, the CEO of Health First Family Care Center. We're a 501c3 nonprofit. I've been operating in the Lakes region since 1996. We provide primary care, behavioral health, substance use disorder treatment, and a variety of wraparound service to our patients. One of the things we are mandated to do as a federally qualified health center is to serve every individual that walks in our door or calls for an appointment, regardless of their ability to pay or insurance status. No questions asked. We treat and see everyone who needs our care. We employ physicians, nurse practitioners, psychotherapists, behavioral health counselors, social workers, community resource workers, enrollment workers, and a lot of these services are not billable. We try to treat every aspect of the individual when they come in. If they're needing anything in the community, we have resources for them. So this is our first ask. We haven't asked any towns, but we, like a lot of nonprofits, and especially in the healthcare business these days, we're getting squeezed from a lot of different directions. So we're seeing our federal funding decrease. We're seeing now the future not looking very bright for insurance, the number of patients with insurance coming in our doors. Medicaid, we certainly anticipate a significant decrease in Medicaid coverage based on state work requirements and then later on federal requirements. We know right now the commercial marketplace, the Affordable Care Act, the tax credit subsidies that individuals have been enjoying are no longer there. Those are going to go away at the end of the year. So we expect many more people to become uninsured. We, again, are a provider of a community safety net provider. We will continue to see those individuals and provide care, regardless of their status. So, it's just that we feel the pressure and we need to seek alternative funding. Like I mentioned, we've never asked for contributions and from any town, and we're on a tour this year, so to speak. And so I appreciate you letting me speak to you. And let me just point out, for Belmont residents, we serve 498 residents in our last fiscal year. That was about 1,500 patient visits. And when you look at the numbers for the amount of uncompensated care that happens in our health centers, that equates to about $9,600 in free care that we were providing to Belmont residents. So asking for $1,000 just as to help us along and to shore up our finances. Like I mentioned, we are getting hit fairly hard by many changes that are coming down the road. Glad to answer any question. I know you're putting in a long day already, so I'll be brief and not go any further unless there's some questions.
Did you say that you are a 501(c)(3) organization?
Yes, that's correct. And as we achieved the 501(c)(3) designation, a few years later, we received another designation as a federally qualified health center, which is a big plus for us, that we can receive direct federal financing and funding. And we also have preferred rates and better rates of reimbursement on our medical billing and behavioral health billing that we do for Medicare and Medicaid, not the commercial side, but a nonprofit. Yeah.
Does your organization have the ability to do outside fundraising?
Yes, but this is where it's the catch-22. We have had to release, well, not necessarily release staff. We've cut our budget quite a bit, over $500,000 this year. And so one of our positions that once they left, we chose not to replace was our communications grant writer and and fundraising position. It's just one of those positions that isn't providing a direct service to our patients. So we're like, hey, let's try it. So I'm working as the fundraiser, and I have my HR director as well, partnering with me to do our fundraising. So we are bare bones in terms of administrative costs, but we try where we can to raise our funds.
Any other questions? No?
All right, sir, we're all set, I guess. No other questions. Thank you very much.
Yeah, thank you.
Okay. Thank you all.
Thank
you.
Okay, cemetery trustees.
Yeah.
Is that you?
Yes, I'm going in there, so yes. Oh. So we kept in mind going into finishing up our second year of a default budget and trying to keep our number low. Unlike last year we came in not really knowing what our maintenance contract was gonna be. We estimated it to be about 25,000 and it came in at 22. Next year it will be 23,000. So we just added, like we normally do, add the $3,000 to it. That will cover any emergency that happens, any clubs that we join, any memberships that we have, dues for our conferences, which happened today. The projects that we have are moving forward. We're working with the Weymouth Cemetery, getting to clean that up. We have to work on getting an easement put in. We hired Craig Bailey. He's gonna do a survey of the cemetery itself because there's no definitive lines to it. However, the Hamiltons who bought that property and built the house there, they're like 3/4 of the way done. So he gave us a really sweet deal on getting the cemetery included into that. So we retained him and he will do that, he said, after the leaves fall. Other than that, that's our major project and replacing the signs. Hillary and her husband are working on designing some signs for us to choose from. And then we're gonna reach out to the DOJ. They did, the DOC, Department of Corrections. They're the ones that did the Purple Heart signs. And those are metal. So we're thinking if we could do them in that material, if they were affordable, then it should take care of, they won't rust or chip or need to be painted, or it seemed to be the best sustaining material, and so we're kind of looking at that option. Our request is $1,000 or $1,500 less than last year.
Any questions?
What does our maintenance contract cover? Like what does he?
So they do spring cleanup. That's all the debris that fell over the winter. They do mowing, cleaning the rock walls out, picking up storm debris, mowing, weed whacking around all the stones in the entrances. And then fall clean. And then as an extra, they do an extra clean after the season is closed. In the 14 cemeteries that get reached to the Reach Across America project. They do that for free. It's a donation.
Any questions?
How long is the maintenance contract for? Does it every year he renews or?
So we've been doing them to save money because of lack of people bidding on them. We do them every 2 years. So we put it out to bid in the fall. Yeah, I mean, in the spring.
We knew this increase though was coming in advance as part of the contract.
Pardon?
Was this increase a part of the contract that we
Yes.
knew was coming? Okay.
So what is this, the second year of the contract?
It will be, And then next year we'll put it out to bid again.
Who carries the liability insurance for the employee that's doing this work on our property?
He does. The company does. We do not. Anything else that's insurance related goes through the town insurance, like we had the Dow Cemetery that had that big hole in the fence by Sunny's house. We had gotten compensation from our insurance company, the town's insurance company for that, after we met the deductible, things like that.
Cause that was like an accident or something. right?
Yeah, it was. But anything that happens with the work itself in there is covered. The contractor has to provide proof of insurance.
That was my question.
Yeah.
My understanding is that you're trying to get that $5,000 that you lost. Are you taking them back to court?
We had a meeting on Friday afternoon and I ran it by them because, do you guys want to do this? But unfortunately, I'm the only person on the board who was on the board when this happened. So I went through the background with them and they said, yeah, if we can find an address to have him served, then we're going to go forward and doing that. So probably that'll be something towards the end of December, the 1st of January, that I will really dig into to find that. That's the fence guy.
Here's a very, to find somebody's address.
Okay.
You gotta call the police department. Give him his last known address and his name.
I don't believe that I'm allowed to do that. I'll definitely ask them, but I don't think I'm allowed to do that.
Whereas, well, the town was defaced of the money, I would think they could help you.
That would be nice.
At least that's my opinion of it. I mean, the town's $5,000.
So, and we're still looking into about the trust funds and things. I don't know, I think some of you have met Kate Eaton, but this woman she loves her research. And so she's really digging into trust funds and stuff like that to see if we can do it across.
It's very, very difficult, because I think what happens is you have to prove, let's just say Mr. Smith is in this cemetery. You have to prove that whatever you're doing is within that cemetery and it's like for Mr. Smith or for that area. It's really fun.
Yeah, it is, but we learned some new stuff today.
Awesome. Thank you.
We have the library trustees next. Do you still want to be put off later until the rest show up? We can stick around.
Just as I'm, now we can go. That's number 4. Huh?
Something like that.
Number 4.
But we will email her.
All right. Fire away.
Okay. Well, thank you. As you know, I'm Eileen Gilbert. I'm the director.
Oh,
This is
yeah.
Mary Charnley. She's the chair of the trustees. I want to say the library's generally as busy as we have been the past few years. We have seen higher use of our digital services, though. One of our ebook services use is up about 40% over this time last year. So that you could say we're a little bit busier than we were last year. We have worked hard to increase our outreach and our collaboration with other town departments. We participated in Old Home Day, National Night Out. We have done some outreach events with the schools and in fact, this week, the police department is coming to a presentation that the AARP is putting on about scams. They said that was an area that they were interested in providing community information about. So for 2026, we have hope for the library expansion project that would provide more seating for the public, space for tutoring, for reading, for working, more collection space, more space for programming. So that is something that is not part of the budget, but it definitely influences our thoughts towards the future. I wanted to point out, as you know, the 2 nationally competitive grants that we got to improve access to our current beautiful building. We improved the entrance, we improved lighting on the ground floor, and we have added items to our collection that are intended to increase the use of the library collection for people with disabilities. Other than that, I just wanted to draw your attention to something you maybe already have a question about in the default for this year. The line 102, we had a vacancy for about 8 weeks in that position, and that is so that the request for 2026 reflects a fully funded line for that. Otherwise, right?
So we also have a request into the Duffy Fund. We have about $45,000 worth of repairs that we need to do with the building already. Needs to have painting under the woodwork. Hoping that goes well with the woodwork, because it's down to bare bones and some parts of it. Up in the corners also.
Talking outside?
Outside,
Okay.
yeah. You notice a lot when you
Okay.
come around. If you park in the back, you actually notice quite a bit underneath. So we have that. We had noticed that the woodwork inside of one of the fireplaces was starting to bubble. We were lucky, knock on wood, that we had actually a dry season. It was very rainy in the spring. So we have to have repairs inside the chimney as well, which then leads to the woodwork being redone by, we're looking at New Hampshire Craftsman, because it was really hard to find somebody that has that trade still, in keeping with the interior and the historical piece of the library. Duffy Fund is aware that we will start to request those funds. We have estimates still coming in. The deadline is 10/10 to have all the estimates in. So we'll be making decisions about those repairs as well. Hopefully they will be done by November, because painting time is starting to run out.
Yeah. Questions? Anyone has any? Yes, Travis.
Can we talk about line 140, the part-time assistance? I know it's all skewed because the 2025 request was 32, the actual was 27, obviously probably wasn't, everything filled, I'm assuming. Oh wait, that's not actual year to date, that's like September, sorry.
Yeah.
So it's 6,000 more requested from 25 to 26, I was just wondering what that difference is.
So there are 4 people represented in that line.
Yeah.
And the trustees made some decisions about compensation that affected that a little bit. We also, there's also an increase in one person's hours to reflect what we've seen from this year's, how we've been using the part-timers this year.
Yeah.
Any other questions? Oh.
Whether that's even for their costs for retirement. It's crazy. And they're still in the red.
Oh, yeah.
Their retirement system costs, it's ridiculous, it's state.
I think we're all set, girls.
I'm gonna.
Thank you very much.
That's. I'm just. You pay ball, you know, pay ball.
You're up now. Hi, Don.
Oh, Don.
Oh, I know. Want somebody to ruin your day.
Yeah, I mean, I pull it over here, and this room was full of sweat, pull it over here. I did, I only opened it a little bit though. Now you. Just be like dying in here, I know.
But your open roof and fine.
I'm fine.
I
I wore sleeveless.
I wore flip-flops and a t-shirt, and I'm still sweating over here.
You can't take the shirt. Okay, Donna.
What do you want to hear?
Anything good?
If there's nothing good, then we don't want to hear anything.
You got it.
Yeah.
I mean, basically, the overall is everybody's seen the news. I mean, Medicare, Medicaid, food stamps, anything federal is extremely scary at this point. I mean, that means that subsidized housing is definitely gonna get hit if it's federal. And there's no crystal ball, so we plan for the worst and hope for the best. As far as my general services, up at the top of your spreadsheets, there's really no alarming changes there. That, you know, that I can qualify other than GA, office services, which because we now have become motel, hotel, whatever you want to call it, managers, if you will. There's some expenses associated to that. And so that line was requested to go up a bit. But considering the savings, it's not even really noticeable. Other than that, I don't think anything in the general category really reflects any changes. The PT labor, meaning for me to step away for a week, maybe two, maybe, and get some coverage, it's gonna cost us some money. And I haven't taken advantage of that, but again, as you know, or most of you know, traditionally I go away for a week and I come home fly home for a week, and then I go for 2. And that's really kind of pretty scary to share with the population I'm serving and the volumes and the come and the go. So after we'll test it for the first week, and then if not, then obviously I'll probably utilize some of that to offset however I can for support services. So
You'll have somebody from another town?
probably, yeah. You know, somebody that's got the experience and knows how to handle things and not get us in trouble. You know, as far as like scanning apps and stuff like that, that's nothing. I mean, town offices has said before that they'd be more than happy to do that, and they email them to me. And my motel room in which of the house we rent looks like Wall Street, so I'm very much equipped to handle it.
Even though you're away for a 2-week vacation, you're working the 2 weeks.
Yeah, I mean, it's always been the same way, so we're not complaining about it, I'm just saying, so that went, there was a $2,400 request in 25 default, we brought it back to 12. I didn't use any, I'm not sure I will at this next little journey I'm gonna take, but if so, it will reflect out of the 1,200, but we still need to be proactive with the 24. So looking at the top part of the budget, I think it's pretty much status quo. The bottom side of my budget, or the more important, is the assistance, general assistance vendors. From I think stuff I printed out from Steve, based off of the 3rd of this month, the housing line that at this point is 129,864. And your budget sheets, I'm not certain where they've been collated.
Yeah, started like that. Could you run down those ones? Do you have the whole row real quick?
Steve, do you have the whole like bottom budget, or did you just do the housing?
The whole bottom part?
Yeah, you have the update as the assistance vendor payments, that's where you got that 129 from.
What line?
Oh, just that whole quick
430.
row.
430?
From 430 down to
430 to
441.
441.
Do you have an up-to-date one for that?
I do. We should. 431. The next one down,
I mean, I can give it to you.
it's really not much,
Okay.
853. So,
And then you have it just all the way down.
it's a little higher. Utilities, 1683, so a little higher. Other expenses, the line's there, 439. That's 1453, so about another $100. And then transportation is the same.
I was doing another.
Yeah, so really that big jump's at 439. The discrepancy.
The only reason I asked that is because I was just looking at, and if, so people understand that we're can't survive with this default, and I don't know if they think it's just hurting one area, but where we're at year to date on your line for that assistance vendor, rate, not including administrative stuff, so literally what we give out in assistance is over 136,000, and default's 94,000.
Oh, yeah.
And
And it will
If you look
be-
at the housing, it's 3 pages.
Yeah.
Right, and I don't expect it will be much less in the next, to close out the year. I mean, we're looking at, an estimate of 4 motel rooms and 6 cottages. And as soon as I vacate, they're full, and tweaking, and that isn't just those. I mean, I have somebody over at the DK Hotel that's costing us $2,400 a month. So, and then there's, the Belknap House periodically, the first 30 days we usually own. And then after that, they pick it up. So, and that's the family shelter.
Now, I believe last year you had come in and it was under 140, we upped it to 140, correct?
Yeah. Yeah.
Because you left it up to us to have to up it, right? And you're gonna spend 140,000 for housing.
I am.
And so we know, I'm nervous that 140 isn't enough. That's what you're requesting.
Well, I guess we'll, I can throw something out there. So there's a new little movement, and
Yeah.
Travis, you might have heard of it, but so the city will account, and it's not confirmed 100% yet, but apparently we're gonna arrest our way out of the problem, basically. So the theory is arrest every homeless person there is, and this isn't the big guy in Washington, this is local concept of thinking, and they'll go to the jail. So basically, we're gonna arrest them and they go to jail. So I said, well, that makes a lot of sense, doesn't it? I mean, considering that we pay for the county jail, and so we complain in the courts that they can't get people through the system, and the system's backlogged, and the people that really need to be arrested are, right?
I thought you were doing God Pod's deal, not this one.
Oh, no, and I'm not talking about,
No.
you mean like maybe wait till ice fishing season and then put them out there, I can tell them teach them how to
So
survive.
in other words, what you're telling us is if they go to the jail, then the county.
It's gonna want, oh, yeah, okay, the craziness of the theory on it. I mean,
Yeah.
ultimately, at the end of the day, no matter, we are not gonna buy ourselves out of this problem. I mean, it's beyond the local, it's beyond local capacity for welfare, city or town, doesn't make any difference. The state hasn't been pushed hard enough, in my opinion, to start looking at their level of responsibility. And quite frankly, I've said it before, and I'll keep saying it, we need a county shelter. But we need a transitional one. There is this problem that the city of Laconia is experiencing with everyone invading, so to speak, for lack of better words, Rotary Park. Okay, and so the theory is let's just arrest them all. Well, so where are they going? You know, and we don't have a low barrier shelter. So that means if you're using, it's okay to go. There's only a few of them in the state, one in Manchester, the other one over towards Keene. And so even the Carey House is supposed to be able to acknowledge they never have space. And so bottom line is, if you had a shelter that had a low barrier section and then the other section, and you can put Lakes Region Mental Health and community, you know, housing stabilization, homeless outreach, and all of those guys are engaged, you know, we may be able to then transition people into some sustainable housing. But right now,
That's not gonna happen in the next couple of years.
no. And I mean, I work hard with CAP and housing, I mean, homeless outreach and housing stabilization. And I have to tell you, I mean, I wasn't here and it kind of stinks, so I didn't know what she presented, but if I lose like
I
them for
can't the last county commission meeting, because someone from Laconia did interact with them on talking about potentially turning this into a county issue, because of, I think though, coming from your perspective would be more beneficial to the county talking about it, because the one that went there was all pissed off with the whole God pot thing, looking at the flames, which I think isn't a good idea for Laconia, but if that idea you have is a little more.
well, like, look at the old Rite Aid building. And I'll just grab a building, because I happen to go think it was open, actually. And I was like, yikes, and then I thought, well, gee, you know, the problem is.
You would hear us furniture.
Oh, yeah, no. Look at go there, it's how much we get out, right? I mean, I know how to go from here to the wheels of that. Honestly and truly, it's the same old story though, Travis. Nobody wants to have a shelter in their backyard. Nobody wants to position one where people are gonna steal their way out of. And so, for instance, as you know, at, I think probably your selectmen's meeting or a meeting, and maybe you haven't been informed yet, but over off the Wow Trail, there is a group. And I mean, you know, they tapped into some free power, you know, they were creative. They kind of trenched a little line and put a extension into it and kind of covered it off and covered it over, and
Did it for the winter.
you know, they could charge their cell phones and, you know, other devices, so to speak, and they just got picked off. Fortunately, that's state-owned property. And I talked to the chief, you know, we were actually yesterday, and a long time ago, that property got posted, and all those posted signs were ripped down, and going in there and I think I said this to all of you when we went into default, and you said, okay, Donna, what are you gonna do to slice and dice this budget 2 years ago? And I said, well, how do you feel about homeless encampments? Because if you remember, I said Laconia moves theirs along and they come to Belmont. Belmont bus cover and they go to Laconia. What did we gain? Nothing other than more chaos and crap left behind. So do we manage these, so to speak, encampments, you know, like, and I've talked about this in different circles where, you know, somebody out there once or twice a week paying attention, bringing a lot of crap in. Well, then, you know what? It's addressed right there, right then. And it's biding us time, because they're not all drug users. Mental health is so out of control right now. It's just beyond your capacity of really getting your head around, period. I mean, it's so bad. And majority of the people that I'm dealing with mental health. I mean, you know, Kevin Wan, he's got no toes, he's whatever. I can go right down. I mean, I like just one person get all their limbs, and I'm not lying. It sounds so disrespectful, but seriously, because they've been trying to survive. And there's so many people right now that have been priced out of their homes. I mean, they really have. They've been evicted. I don't catch them until it's too late. And then they couch surf and go wherever they can, and then the bottom falls out, and the rest is, you know.
It was like the other night when I saw you know, there was an outside fire on a certain road in Belmont. And it said to stage for the police, and, you know, I ran into the chief and I said, oh my God. And he says, well, what was the number? Because it's
Still the campground.
more than one on the road. There's more than one drug house on that road. There's 2, 3 of them. And so I said, well, what numbers are they? He whips off the number. Oh yeah, it was that number. I'm going, oh.
Well, that's my issue with the whole camping is that I know it sucks having to kick and push, but like a safety, more or less safety for the community, because then wasn't the fire on the bypass a little while ago because of encampment?
You mean off of Hounsel?
No, we had
I
one.
was gonna say,
We had
because
one
actually,
in
it was
our
well
town.
maintained, and one of our reps decided that they wanted it out of there, and
We had one in our town that, I can't remember, it was like right near the end of the bypass.
You mean in the circle thing?
No, it
oh,
was-
no, right over the banking.
Yeah,
It was
the
right,
fire-
like, once you
right,
pass,
yeah,
right,
because-
once you pass
so,
the,
That's my safety concern.
oh, yeah, I mean, and I don't disagree with you, but again, you know, we strip. If, like, for instance, Community Action come in, how much is that, how much of their, I think they were asking for $15,000, how much is that going to housing stabilization and homeless outreach? Okay, I mean, and I'm not discrediting fuel and electric, I'm petrified, I haven't spent anything, and I'm like, oh no, so if all these federal cuts come down, what are we gonna do? Am I gonna need that here? But yet their funding, you know, sources, we still don't know where that's
Well,
gonna
and
be.
I asked that particular question. She said, we've been, you know, we're gonna have this funding. And I said, today, what about next month? And they don't.
No, they don't.
They
They're,
absolutely
you know, they're hoping,
Of course.
but I mean, and everyone says, well, you know, it'll get stopped, but I don't know. And there's a lot of really, I mean, you know, people say, oh, it's people that don't want to work. That's not true. I had a conversation with my husband who thought he knew it all when it came to the homeless population. Why don't they just get jobs? This is crap. And I said, okay, let's have an educational moment. I have a man, and here's a good example, and it's the honest to God's truth. I have a guy who would love to work. And he's not in an encampment. He's tucked in the woods. He has no transportation. Okay, and he has some issues with his legs, too much information. Bottom line is he buys a $10 membership at Planet Fitness so he can get a shower and use their facilities. He has to walk there. Okay, he's living in a tent in the woods. And I'm not going to call him a baby because I know if I put a tent on my own property, there are bears, and now we got bobcats. So when I go, well, you know, one night's okay, but when you start night after night and you're not getting sleep the right way, you're hoofing to get a shower or do your laundry or whatever. So you know what? It's not sustainable. You can't keep a job. It falls apart. And I said, so it's more than just get a job. The guy says to me, Donna, you know what, please, you know, is there somebody you know that goes by here that can pick me up? And then maybe if I can bucket up a little bit of money, maybe I can put an ad out there to rent somebody's room. And I said, oh, I might have somebody, but that's not, it's again, I can put somebody in somebody's home that said, hey, look, if somebody's really hot up and they're not a bad person, you know what, I'll rent a room to them. But then if they can't keep the job because they got no transportation because the person that's supposed to be picking them up isn't picking them up. And I always say, listen, you know what? I mean, I'll consider taxiing somebody, which I used to, but now $40 a one-way ticket for, you know, taxiing is crazy. But a lot of times you can get somebody that's passing by. And then it's just like.
That's a full-time job in itself.
But that's what I mean, you know, it's kind of like.
How much
it
do
is-
you do?
And there's only one me.
Well, the issue with the federal funding is it swung so far one way that it's now being ripped back the other way, and give it 4 or 5 years before they figure out where the actual happy medium is. And that's they gave money to everyone, and some that probably didn't need it, and now it's being yanked back the other way. Basically.
Well, that happened during COVID. COVID
Yeah.
really created a huge problem. And it, for lack of better words, there was some entitlement with extra funds. And it's just like food stamps right now. Now, I think it's $94. Now, some individuals have been cut because when everybody was homeschooling or working remote, there was food stamps went up because of the internet. And so now if you are a renter, or for that matter, you know, housing period, and you're paying for internet and another service, they won't touch your food stamps. However, if you, I don't want to screw this up, if everything's included, they're taking $94 out of you because your internet is included, and therefore the purpose of upping food stamps was because you were getting, you needed that extra money because you were working remote or whatever. So it's another kind of downshift, if you will, back to somewhat normalcy before. But now, when you go and you buy a gallon of milk that used to be $2.23, is now, you know, $3.25. So whatever, it's really, it's a scary state of affairs. But we are not buying ourselves out of this homeless situation.
So the 140,000 for housing is not enough. We went through this last year.
Yep, we did.
We did, I mean, but there's, but we had a default, I mean, I've tried to say, what if we don't pass a budget? I mean, look at it this way. So if I budget 140 and this is my, so first off, I think you've heard me say this before. I never ever look at numbers. When we build a budget, I truly hardly ever look at my budget. Because the minute you start trying to worry about lines, you are gonna screw up. There's no question. And so my theory is, if you look at some of these other lines that I didn't touch, there's, you know, hopefully they're not elevated. I mean, I still have to budget for them, but there's usually a few bucks here and there that will offset that other piece. I mean, I'm gonna hope that I don't have to rent 10 rooms, whether they're this so many cottages and this so many rooms, but
You're pretty much gonna use your $140,000.
I am.
Okay, and
I'm gonna go over it probably by
Yeah.
about 8.
okay,
Easy without anybody.
and okay, so. And we know that you're going to need housing, if you find housing for more people. I mean, so you can take all the $150 that you didn't use, and you can take the you know, $100 that you didn't use, but
The lines don't matter.
no, it doesn't matter. You don't have enough in that housing line.
Well,
You don't.
Yeah.
Okay?
I feel so bad because everybody comes in here and they skim and they scrape, and you guys are always trying to like throw more money at me. And
The department isn't something that we can.
yeah.
We can't have people having a budget, having services, that's what sucks.
She's averaging about 15,000 a month, so if you add another 40, that's going up till September, so if you do October, November, December. It's another 45,000 on top of the 130 currently spent, like putting you around 170.
So Steve, some of those monies are isolated situations outside of this whole.
But this is what's been spent.
right.
Right, oh, yeah. No,
So I mean, we have to look, again, we're
this
trying.
last quarter has really fallen apart.
Of course. And do you really think that January, you know,
Right, it gets better.
it gets better? All right, you're already gonna go over your budget, and this is only October, the 1st of October. You still got
2 months.
Free, you pay at the end of October, end of November, end of December, basically.
So we've already paid for October, so we have the month.
Oh,
of
it's
and
the end
then
phase.
the month of December. Yeah,
Another
we did.
30,000,
Yeah, 1530 as well.
Yeah.
It'll probably be.
so again.
Whatever.
With
You gotta do
what
what you
we're
gotta
all hearing,
I just,
you know, what do we have to increase the budget, because she doesn't know.
You're gonna have to increase what they ain't gonna pass anyway.
Well,
It's a moot point.
I know, but.
They don't get it. It's a game with this town is in a game situation.
well,
I watched these people pretty hard last year when they came in. And I watched young people march up there we had some pretty good questionnaires in the voting of how to vote, I mean, as far as what to vote for. And they went down, you could tell, I could tell you right now, when he walked by where we were sitting, 99, you could see his
Oh, yeah, straight line.
straight line, no.
The
We didn't-
problem is,
No,
it's not gonna change, because wasn't there an auction this week?
Oh my gosh.
Yeah,
mean,
an auction
even-
this,
Jamestown.
I was bored.
yeah,
That house next door to me, $310,000.
That's a demo, isn't it?
Yeah.
That's a demo house. That's not
You
even
know,
one.
people would
I'm-
bury the
I'm-
contract that level it.
clean problems can be fixed.
but imagine what's buried in it.
Well, that's, so like, what Ruth was talking about when, but also when I'm talking about the defaults, I don't think they,
It doesn't matter what
the
the
voters
default
though
is, we
don't
still
see
have
the
to
fact
do
that
this.
her requested, which is, I think, obviously gonna be too low, your requested for this year, is 72% higher than the default, and that's less than what we're spending, it seems like. Like, that's a big, and like, oh, the percentage is so high, like, they don't, I don't think they don't look at this or really get into the numbers.
They don't realize that.
How much we spend on
we're
welfare.
3 years ago, right, right.
But they also don't understand it because it's not personally affecting them.
And we can't tell you to take
And
it
that's
out.
You know, I mean, it's not until it personally affects someone. That, you know, oh, she's just giving everything away. I'm like, spend a day with me.
Or we say, no, we spend this on legal. Fighting
Well, that's
for it.
the other, and it goes back to the same old thing about this whole county piece and stuff, and cities and towns need to band together because the little towns, and we used to be a little town, and I think we still are to a certain degree, but the smaller towns, you know, they're, no, you know, so, okay, but you take the city of Laconia, us. I mean, even my little town in Northfield, I mean, you know, they're like, it'll probably be close to $60,000, but they got a winter shelter grant, cold weather shelter grant, so that saved them immensely. Our county hasn't come up with looking at like winter shelter grants or anything of sorts. I mean, Merrimack County couldn't give money away, and that's the honest to God's truth. The town of Northfield got $25,000 for a winter shelter grant. It's unbelievable. And couldn't, in fact, got another dip into it, I think another $15,000. Because there was available monies. So how can Merrimack County do that? Belmont can't.
They can, but they have a bigger population base to use for numbers with Concord and all that.
Yeah.
But we,
Cities and
I mean,
towns
they
never
could.
reached out. They
If
never,
not, we could.
I was like, listen, town, let me tell you, I wanna see the grant paperwork on it, cause I'm gonna. But I don't know.
Well,
And then just one thing and so if you took, let's just use 140.
yeah,
So, because we still have individuals in need, okay, so if we kept $30,000 aside and we were given $110,000 to a shelter contribution, we're still ahead of it because it's still going and people are getting services and then they become residents and taxpayers of our town because they can then move on, you know, the people I'm gonna tell you, it's, you know, it's beating a drum. I'm really, really worried about our seniors. I'm gonna tell you right now, you know, when these shifts stop, Medicaid, when the Advantage point goes away, because they don't pay anything, right? And that is pretty much gone. And then, you know, the food stamps trickle, they don't get a lot, but you know, you think about $40 for a senior, and then you know, not knowing where we're going with heat and electric. I didn't even talk about
well,
that. I
and
mean, that's the
well,
other.
okay, and that's my
which I
other
might
question
be able
is,
to
okay,
do.
heated. Now, again, she sat in front of us and said that the applications are coming in. They've been told that they've got the same amount, I understood, right, as last year, whatever that is, okay? But then there was that, but really it won't be confirmed. I think it's December, isn't it?
Right, December 1st is when
Right. So here's a good example. We don't know yet.
but their numbers are gonna increase because when you have a fallout somewhere else and product, John, I mean, I don't know, you can I don't know, it's gone up no matter. And so.
Do you have enough money in your heating line, God forbid, if,
I do, actually. I
Well,
mean,
she said they already had more applications
process than they got last year. Right. But I was wondering if that was because they opened it in July now, before it was September, but they've been doing it.
The last year they did early too.
Yeah.
Last year was really early.
Yeah.
I mean, because they wanted
And
to get
then
our
everybody
seniors
was
out of the
fighting
way. You know, our people that were really challenged. But anyhow, okay.
Well, my
Halfway
suggestion
through
is
the budget.
to increase that, but that's my suggestion. Good or bad. I just,
So let me make this suggestion.
what's that?
So you're trying to build, you know, obviously you're going through department by department. Let's give it, I mean, I mean, and I'll still be in front of the budget committee. And at that point, I may have a much better idea of where some of these other numbers truly are gonna be. I mean, you can change my housing, change it to 150, add 10,000 there.
It's gonna add
And
20.
no, I think that's if you wanna build, if you wanna sell budgets, I mean, if you wanna sell this.
To be recognized, they don't think matters what the.
But, okay, so
was so close though last year, I think we can pull it if we can.
I think
just
you're right.
A little bit.
I think
It
you're
was
probably
so close.
But the problem is, has Shaker Regional come out and told us what they're, what?
We don't
they
care about
expect?
them.
Doesn't matter,
It does.
because they're on
We don't care about
the
them.
front page of the Concord Monitor, they're this, so we don't know what their request is gonna be yet.
But
Yeah, it doesn't,
they're
no, it doesn't
gonna
matter what
get
they
it.
asked for.
They're gonna get it.
They're an island
We
of
got
their
the
own,
budget.
so we have to
Totally
promote
agree.
the
But
sustainability.
you don't think that with the school increases and everything, that people say, well, school's important, so we'll vote down the town budget?
No,
You don't think that people think that?
I don't think it's gonna be, I don't think when they go in that booth, did I vote this one down or this one down? I think if you look at the population that's coming through, their focus, many of them, if it's school, then that's what their focus is. The town isn't, it's not like, I'm gonna vote this down because it's their
So
main
if they're
driving
voting about
force.
School, how are they voting, what are they voting for the town then?
But if you look at
They're
what
very
the
stable.
school didn't.
They wouldn't, when I stood out there last
Sal
year,
requested.
handing out those budget papers and showed that the school is not, 90% of your bill goes to the school. 86 cents of a dollar that we take can go to the school, and people thought I was lying.
Right, and so John, I can pull my ballots out and the whole bit and look, because we always get theirs a little later, so that night the stats aren't exactly there. But I don't think on the Belmont, I think Canterbury always leads the school. I mean, it always.
Belmont voted down the school budget last year. Canterbury saved them by 3 votes.
Correct. So going back to your statement, I'm not quite sure that, you know, that there were people, there was a different vein of people that came through. I mean, I stood with you all day, and I have to tell you, there was a different group, a lot of people we've never seen before. And it just trying to make a connection, and we just have to, well, you have to.
You have a lot of these people that are coming in and buying these homes, $600,000, $700,000, $800,000 homes. They're not looking.
But I'm gonna tell you, the people that bought those $700,000 and $800,000 homes 2 or 3 years ago, starting to ask questions.
Oh, of course, because they paid too much.
Because
And our assessment
And we
isn't
knew
gonna
that.
change for 5 years, and all these people are gonna be paying $800,000-$900,000 on for their taxes that basically. Yep. But that's another recession gonna come back and bite them.
Sonny, what do you think?
And Ruthie's kind of sparked it up, but I don't think you ought to move your budget. You're the smart lady. You've been through this years and years and years. You know what you're doing. When you say 140, that's what it ought to be. I'm not above you changing that at all.
I just think, personally, I think we should leave these numbers where they are.
And
Play it out a
We've still
little
got a few
bit,
weeks.
and then when I get to the budget committee, if I think that there's gonna be some really. You know, because we don't know what is the county, you know, is there potentials, you know.
No,
God is
it's
telling
not.
us.
It just got brought up as an idea recently.
Well,
But the individual that brought up them is not gonna be perceived as a fair individual for that board. So I think someone like you talking a little more of the commissioners might help too.
So
Because he's coming in from Laconia and he wants basically them to take over Laconia. and trying to sell it as a county project. But I think he wants to focus to Laconia.
And I guess I need to either, and because, and just,
And we're only
and I get
the
the,
county budget, we don't,
Oh, they got theirs.
they've got.
Oh,
theirs.
yeah, it'll be, sure, like usual.
Oh, but how much is it gonna be? Yeah,
No, that-
yeah, we don't
no,
know
that-
that. Right, I would then,
I just think honestly, you know, let's watch it a little bit, so we really know where it's gonna go. And then if it looks like that I really and truly do need to adjust it, which I probably will, but I'd rather see a little bit first where we're going.
I was gonna ask you about, I'm gonna ask you since we have her here.
Now, since we have you here, we would like, oh, sorry, I do just have a quick question and doesn't really pertain to the numbers. You never really hear about homeless people dying during the winter at the time it happens. Every once in a while, I see a thing in the newspaper that there was a memorial in Concord for the 35 people that died in their tents over the winter.
Right.
Has that happened here in Belmont yet?
I mean, I don't think it's happened. I don't think death has happened. Do I think that individuals have lost their feet, their legs, that froze, gangrene set in because they went back into their vehicles or their tents? Yes, but I do not feel that we've lost anyone, you know, freezing to death in my backyard or yours or anyone else's. No, that we know of. But then again, you know, if there's an ambulance call that there's a deceased person, I still think no. I think the answer is no. I don't believe so. But we do have a lot of encampments in town. I mean, and they're growing. And Ashina Miller from Community Action, just in fact, while I was in here, she was sick because she was gonna be with Beth.
Yeah.
Had asked me.
Yeah.
Because
Because going next, Ruth table visit, you can.
you mean all the social service?
Yeah.
well, we just want, you know, it's really easy for us to sit here and listen to everyone. Everyone needs money and they want money. And, you know, and I guess my problem is that I don't wanna support a service that's really not helping you and helping the residents, okay? So I guess.
Unfortunately, I feel like we have too many services on those, that we probably should start pulling them out.
Right, you know, it keeps it's growing,
Growing.
all right? So let's start to the top, well, not to the.
Yeah, South Road Cemetery, let's talk about that.
South Road
So how do you feel about that place?
We don't, but actually South Road Cemetery does have a plot for both county and the town.
Yeah, both.
If someone is deceased, there is place to go.
Does the county give Sanford Cemetery money?
The county?
Yeah. I send them a bill once a year for.
Oh,
perpetual-
they pay for.
for-
services,
okay.
yeah,
For
don't-
perpetual care. It's not a lot, but they have a plot there. And I think, and there are people buried there. We kind of think that maybe a long time ago, it might have been someone that passed away at the nursing home.
Yeah.
Or I suppose the county day home.
Oh, Mr.
Okay, Granite V&A.
Yeah. Well, I'll say, since I wasn't here, what it really threw me off was they didn't provide any charitable or subsidized care this year for Belmont residents, which really
Yeah, that guy.
threw me in a circle.
I don't know, how was that?
I don't know, we
Right there.
really straight
Yeah.
asked them, did you
Then
provide?
he screwed up because I kind of ripped some of this apart a little bit. So it says on their August 20th, 2025 handout that they gave you, that they had, they provided 62 residents and they were requesting 4,000. There were 807 home visits to 62 Belmont residents.
Yeah, wait.
And Granite, what are you looking at?
Oh, Franklin.
Oh.
Like, guys, what are you talking about?
Yeah, Granite being.
Granite V&A.
Everything's spread out on tables in the hospital.
Granite V&A.
I didn't put paper clips, so.
On the backside of the paper.
Yes, when my.
No, I got it right here.
Plan to not see their number be 22,000.
So this is the only thing that I didn't see a number here, but, so they were asking for $11,000, right?
Mhm.
So, In 2023, we approved $22,000 for them from some of my printout that I had. And they served, and this year they're requesting 11,000. So then I went through.
They requested 11 because they only requested what we gave them due to default. That was their answer.
Okay,
It was
but-
double what we gave them last year or this year.
but in 23, they got 22,000. So that's a significant cut. I mean, and so I don't know, like, how do you, it said,
Well, yeah, like, sorry, I would have, well, seeing something like that makes me not trust that request from the agency.
I think
Like,
somebody
Lake
else
Region
is
Mental Health,
putting it
wouldn't
up.
give us a dollar breakdown of what that request shows.
well, if you add up patient clients, I think they didn't they, and I'm just
So yeah,
kind of
this,
looking
this
at,
number on the backside, you're looking at the budget, that includes reimbursement from insurance and everything, so I asked them. I first asked about the insurance, like. Is the insurance coverage from our residents have going up, down, from less people having insurance, and he I mean, correct me if I'm wrong, he straightforward said they didn't provide any charitable care.
Right,
This
because
year.
there were no charitable.
For Belmont?
Yeah, we tried to get this.
Yeah,
But he said-
because I asked him again.
I know, he was pinch hitting, that's what threw me off for a second. there.
Yeah, so I don't.
so if
know
I was you,
that-
I would hold on to this and ask about, let's ask a really specific question, because I know that that's crazy. My dad passed in January, and the whole month of December, I had, I don't know how many people in the.
The Franklin VNA gave $20,000 of charitable care for Belmont. I can't think that Grand VNA didn't have any.
Yeah, I mean, honestly, there, and it's not to, pigeonhole one against the other, but they traditionally,
So
they-
basically, what their request is not unreasonable.
well, I think their request, if you base it off of 2023,
No,
and they've got 22,000, and this year in 25,
Must have been the year we had the cocktails before the meeting.
it's not very good right now, John, let me tell you.
And that is what you look at the numbers right now, looking back at them, that doesn't make any sense.
Yeah, but it
No.
passed here and it passed budget committee too, so we were all.
Well, if you look at it though, like Franklin
All of them
VNA,
cocktail beforehand, right? No.
Franklin VNA is 4,000, they provide care for about 105 residents. Grand VNA 240 residents, but they're requesting 11,000. It's just, I think we need to somehow find a happy medium with our VNAs, because we do have a lot of elderly residents, we do have a lot of hospice care that's needed, but we also need to find a way to balance what we give these VNAs.
Well, one of the things too is if you read the newsletter, there's a bunch of different things in there, but Aaron from Lake Region VNA said, we do clinics here, here, and here. The girl on mine from Franklin said we do Great Brook, Mount's Landing, and there was another place. that
Right.
they do. They're coming in here, they're doing flu clinics, they do CP. These agencies are coming into our community and trying to reach everybody. And I don't see that with Granite. They, you heard it, they serve 72 towns and they didn't do a charitable anything in them.
I actually had thought that they had purchased Lakes Region.
They combine, no, they combine with, it was Concord VNA and Central New Hampshire VNA
Yeah.
combined together.
It does say that Belmont funds are used to serve Belmont needs.
So they do earmark their funds.
That's what it sounds like, and I think I remember that from last year also.
I know I asked.
Probably the
some-
same
I can't remember who I asked.
Probably the same one.
And why, I know I asked Legion Mental Health that specifically, because that's a tough one.
All right, so the VNA,
So, here we go, in
Wow.
2023, they served, well, and I only had visits, 628 visits. In 2025, they have 807 visits, and I think it was the same money for Granite VNA.
Doesn't it say, it says Belmont residents receive 4,205 home visits by the agency?
But those are reimbursed, most of them, it sounds like, by insurance. That's why I tried to get him to tell us what the charitable number was, but I don't feel comfortable giving money to an organization that doesn't have a lot of charitable care to our
I
town.
agree. I mean, you can do one or two things.
And I don't want to penalize him just because this guy might have screwed up talking to us also.
Well,
We
Alicia,
might have time to ask an additional question.
well, I was just gonna say, Alicia, could you send an email? Maybe tomorrow? Well, it doesn't have to be tomorrow, but do you think you could send an email and ask?
For
That-
clarification on-
Right,
Charity care, subsidized care, something like that.
just something so that, you know. Okay, let's talk about community action. Let's skip the VNA for the moment. Let's talk about community action now. They're requesting 15,000. They did that in last year also, but we only gave them 13 because obviously default budget. And I know you work a lot with community action.
My primary contact. I mean, everybody goes to Fuel Assistance Electric. I help with those apps, you know, or if for individuals that can't facilitate them. However, I will, my biggest contact piece is the housing stabilization and homeless outreach. And I don't know where the monies are going because this number, if you look at the very last page, housing stabilization. I know that
So
there were more than 3 people served.
So I asked them about those two, the permanent and the housing stabilization. I guess that's more of just like a temporary help, like if someone's behind like on a month or a couple months. And then the permanent one's like a step in between that and section 8 until they hopefully can get section 8.
in.
I just wish we could tailor, say, you know what, we're gonna break it down, where.
Well, it's
You know, homeless outreach, like you're 15, so 13 is going to this and, you know, 2,000 is, no, I'm just saying.
And when you're looking at that housing stabilization, it does say 3 people, but it only says 1 house. So
Yeah,
it's 3 people in 1 house.
I don't even, I can't even imagine. I mean, I know.
But the value of service is only $3,000, so it does kind of correlate.
And that might have been, some rapid rehousing funds or something like that they had. That's not them. So let me explain to you the, homeless outreach piece that I work with a lot is, and then here in Laconia is, Ashina Miller. And basically, and she was sick today and she apologized 100 times for not being, but when I say, hey, listen, I got somebody that's homeless, are they on your radar? Where, you know, what, and she's like, Donna, you know, did they call 211? Have they got in the system? The system then generates and comes over. And the minute she gets them, I mean, it's boots on the ground, trying to find them a landlord, subsidized housing, you know, shelter with me, you know, I'll say, this is where I'm at. What do you, nope, but tomorrow this, so get back to me. I mean, it's.
So in other words, this is, you know, there's all kinds of things that we aren't ever even gonna figure out, okay? So my question to you is, as a taxpayer, $15,000, are we getting our money's worth?
Oh, I think so, yeah.
Okay,
I mean,
that's
from
what I'm
that.
Because I don't need to know all, you know, it makes me sick.
Oh, yeah.
Okay, so when they're requesting $15,000, we're getting our $15,000 for it. Okay. CASA,
Sorry.
Go
ahead.
I love CASA. I hate that they didn't show up. I think I don't really see a need to continue funding that. I think they have enough funding from their other sources to maintain that.
okay, so let's eliminate that. Here we go. We're on a roll. We're
Yeah, CASA does
eliminating.
great stuff for us,
So
community, but.
I have a, Red Cross is one.
Oh, that was zero on my list too, don't worry.
Because
Okay.
last year I asked them, how many residents in the town of Belmont did you serve? And they said 0.
And I immediately, when I got my book, looked up
Yeah.
this year and they only served one.
I had.
So we gave them, can you remember, $3,000? We gave them $3,000 and they helped one family from the fire.
And you know, the other thing is when you're talking about.
Yeah, so the CASA,
Okay,
I'm down.
passes zero.
oh, I do too, but again, I mean,
I
I
love
think
CASA.
we're looking at the,
We're looking at what is it doing for our residents? I mean, now Red Cross, thankfully, we've had no disasters. The Knights of Columbus at the St. Joseph's Parish, I think close a blood drive, we can turn around, so they're here. Yeah.
So can we just go down in order first, or we just?
you're losing me here.
Well, I'm going.
I'm still lost, because we jumped from CASA to like.
Oh, Sharon, that's your fault. Okay, let's go to Wade.
Well, so we, is the whole board good with CASA?
I'm fine with that. Okay, we're gonna eliminate CASA, they're not getting the talking.
I have no idea. Do you want Waypoint? I have no idea how many people have served on there.
So they said 12 healthcare coordinators.
Number two, we're on the, you're.
From healthcare.
Coordination, so they have coordinate through
Yeah, we are.
healthcare,
We're right.
getting healthcare from the insurance stuff.
What is this, Waypoint?
Yeah,
Says they help two families.
they said 12. So
Oh, I'm sorry, 12 families, but I don't know.
Because they don't have that on their.
No, yeah, so because of.
It provides services to, long-term services to family with, pediatric chronic care. And they said a lot of the caseworkers stay with the family right from birth up to age 21.
Well, that's what I was trying to do with
Yes.
VNAs. No, I had a child with chronic illness and for the first year, I had someone from a VNA every day. But
What do you want, Waypoint, what does Waypoint do for you?
I haven't had any interaction with them at all
Okay,
whatsoever.
no, cross it off, they're not helping us. I mean.
They're saying they are. I have had no, I
Okay.
haven't sent it, I mean, I haven't.
Cross Waypoint off. New beginnings.
Can we just quickly, I'm just trying to figure
Oh,
out. So you think you want to cross out their funding?
yeah.
So they did say they work with our police friendly beginnings on one of their programs.
Is that where you're at,
Yeah.
New Beginnings right now?
Yeah. Yeah.
So New Beginnings in 2023, you gave them 1,891 and they served 36 individuals. In 2025, there's 39 individuals and they're asking for 1,418. I mean, I have worked with their office. I mean, there's several people. I know PD does. I don't know what the outlines are, but.
I should give them. And I don't have a problem with the 1418. Now we're back, now we're down to American Red Cross.
I'm okay with it.
Okay. I haven't needed any blood lately.
Well, it's not, this is.
No, it is, it's.
We got, I think, out of control with health agencies, and I think wheeling it back in to see what's actually directly benefiting our community. And
What has American Red Cross done for you in the past year, Donna, to help residents in town?
I have had no interaction, but they don't have a request for monies on their request form. Unless I missed it. I've read this thing over several times.
They requested 3,000.
But that was in person, but the document that they sent in advance. That
Yeah, but we must have had
I
something
was
because
sent.
we just come up with,
And I got this whole document here. I read it like 4 times, trying to look for the amount they were looking for, so I could cross-reference it and.
Might have gotten that out of the email. It might have come from like the email that they sent. Where that number maybe came from.
Yeah, this is the same one that you have right there.
Yes.
So-
all right. You wanna eliminate American Red Cross? Done?
I agree with you. I agree.
Yeah. And again, we're doing this, if the budget committee wants to change it and bring it, my phone's all dying on me, that would be on them. Lakes Region Mental Health. Huge, right?
So did they present today?
Yeah.
They did.
Yeah.
And what did they're looking for, what, 15,000?
Say 20,000 basically, 19,921 is what they're looking for.
Which, in the other thing, they did show that they had, what, 251 residents of Belmont, serve 63,000 charitable care. Which if I remember correctly, last year I did ask them if this one was earmarked for Belmont, and they said it was.
Well, they bumped it by $5,000. 25, they wanted, they asked for 14,000.
Right, we only gave them 10 because
No,
of
we only gave 5.
oh, we only gave them 5, sorry, that's right, because we had to cut everybody.
I mean, they're definitely, I mean, mental health is absolutely, it's out of control. And they do have, the only thing, and it's horrible that I wasn't here because they were supposed to be, I think they had applied for a grant and they were supposed to be putting a transport vehicle on the road.
Oh,
They were
really?
and that's huge. I mean,
She didn't
transportation
speak of
for,
that at all, well, I think she spoke of grants, but she didn't speak.
and
of
I'm gonna ask, I'm gonna reach out, because if,
You come back to when they do the.
All right, so we'll keep that one. Shall we keep that one at the moment? Until we.
Decide.
Yeah, we revisit it and then when we do the bids.
well, I mean, when Medicaid gets cut, like it looks like, they're gonna suffer as well. I mean, the health first piece is when we get there, I really do wanna talk about them a little bit.
Yeah. All right,
That's,
okay, well, let's go to, well, the next one's Franklin B&A, which let's skip over that. At the moment, because Franklin ran it and Lakes Region B&As we're struggling with, I guess. Partnership for Public Health. They've requested $3,000. Have you ever done anything?
oh
with
yeah,
that?
all the time. I mean, they're the ones that help, especially with like insurances, like our seniors or people that have disabilities can go and they can, put in all their information and then pull up different insurances and what they cost and they're
So
they're a huge asset. They also help the emergency response. They give PD and everybody all kinds of extra,
So that's
I don't care
$3,000.
about that. The National Night Out, they distribute, the drug take back days. They offer us as a community a lot.
Okay, all right,
And then, of course, they help with, like I said, the insurance piece, which is.
okay. No problem with that, okay. Family Promise of the Lakes Region.
So for that one, I think their idea is perfect for what the way to get out of the issue we have. I just don't think funding a startup from the community is a smart idea. Because when I worked on Burgess House of Hope, we did all of our fundraising through public people, and that's what showed that we could stabilize ourselves before going to towns and counties for money. I think if they can, I think later on the road, they might be a good agency for us to help if they're able to get started, but I think they need to start themselves up before coming to towns.
I agree 100%. They're seated in Concord. And what they have is a lot of like host homes where individuals will take in homeless families or individuals, that are needing some extra help. And I mean, there's wait lists and there's a whole criterion parameter. I know they want to try to put a shelter in place here in Belknap County, but I think that they got a long way to go before we can. I mean, they're asking for $5,000, aren't they?
Yeah.
Yeah.
With Burgess, we even got a building started, a house started, and I left the board once they actually opened the house. And it went downhill so fast that they ended up closing the nonprofit. So I just don't wanna see that happen to this, and we give
Then we
tax
can
money,
tax money.
it's now useless to helping the issue.
Well, and it would be interesting too, like on majority of these, like what are the other cities and towns? What have they requested? And that probably would have been, and I apologize again, but that's what I've been asking, like, what did you ask for Guilford? What did you ask for? Laconia. Laconia's a city, so you take them out of the equation, but some of the other.
That's presented to the budget committee,
But that would be healthy for all of these, like, what was your request for, the Belknap County communities? Just so that we don't look like we're out there and discrediting something that they're really offering us. It helps a lot.
Well, they haven't gotten off the ground yet, so.
No, with these guys, I mean,
Yeah.
All right, so do we cross out 5,000 at the moment?
For now, for this year, I think, if they look like they're making some progress.
All
And
right,
I know their theory is as well, we're not gonna make progress unless we get seed money. But I think there's some other ways that can work.
we're not in the seed money giving.
Well, especially when we're working off of 1200.
You're right, that's right. Okay, health first.
So Health First is not only, they're a federally qualified health center, as he said. That means no money, slide and scale. And so they have mental health, they have, they offer a lot, a lot, and they've never come to us. And so when I saw that this year, they give like some transportation vouchers so somebody can go to therapy, for them, there's a lot of
Well, I
different.
think he had said that this is the first time they're going out to ask, and I'm sure because they're like everybody else, they're afraid.
Well, they're huge Medicaid base, and knowing what's coming down and the mental health component that they offer is pretty, and they're here, they have one in Laconia and one in Franklin, and so dependent upon where the availability of services are.
So you think the $1,000 is, we should be paying that?
Yeah, I would have expected more than that.
Well, he said they're out testing towns, right?
Right, and I had asked him about, because he is a nonprofit, I asked about fundraising, because you can tell that agencies that go way out of their way or work really hard at fundraising. And he actually said they don't have a lot of that, but the person that they had left. And to save money, they didn't fill the spot.
And they're trying to do it internally.
Position to be in, if you're,
Especially with federal cuts coming like
right,
they are.
exactly.
These guys, honestly, I have to commend them for the amount of work and effort and how many people they support from the town here. In fact, a good percent of individuals I send to them just because I know they have.
So I guess we should pay the $1,000 with a smile on our face.
That would be a great benefit.
All right, so now let's go back to the VNAs.
We gotta do some, I think. What?
No matter what you give them, they're still going to support the community. They're still going to come in and support the communities, right?
Yes.
Just what throws me off for some of them, so like, for example, Lake Street and VNA, I don't know which number he wants to give us for residents. It was to me 65, 75, and the Alicia was like 75, 85 residents. The guy from Grant,
Between 60 and 80.
60 and 80, I say that, okay,
Yeah.
say 70. But that request 7,500, but then you look down at like Franklin VNA, which is 105 residents and impressive 4,000. Like, we have to find some, I think, some type of balance on funding these and the impact on residents.
Which one are you looking at? Are you looking at?
Oh.
Grant? I'm looking at.
I mean, do you just fund them equally? No matter how many people they work, how many people they serve, do you just pick a number and give that amount to each person, each organization? To be fair to each organization? I don't know.
So Granite DNA said they assisted 4,205
Visits,
This, yeah,
not residents.
240 residents.
240 residents.
That's the grant, am I correct?
Yeah.
We gave them 11 grand last year, they wanted 22.
Yeah.
Give them 11.
Right.
But they only requested 11 this year too, and I'm sort of like, well.
Yeah.
What do you guys actually need?
And how many residents did the Lakes Region VNA?
Let's just say 70, because that's the one that was
70,
all.
okay, and then how many residents did Franklin? That was,
Sorry.
I had 105.
Yeah.
All right.
I just want to know how many people they served. I don't
That's
care
how
about
many
how
people
many
they
visits.
Yeah, that was the.
So Granite served 240 supposedly, Lakes Region 70, and Franklin was 105.
I know from my experience too, if you go down to the hospital and you need to have a visiting nurse, 85% of the time, the doctor that's discharging you is going to recommend that you use Granite. I think just because they're bigger, because they used to just recommend the agencies that company bought out. So I think Lakes Region and Franklin have to work a little harder to get clients.
So Franklin,
Requested 4.
and how many residents did you say?
That's 105 residents from Franklin VNA. And then there's 70 residents from Lakes Region VNA, which is here that way. What's the
So where
difference?
did you, I mean, because the document again, and what did he verbalize that today? So it was increased. Well, this document is through June 30th. So maybe that's where he's ramped it up, because the one that was dated August 20th said they had 62 Belmont residents that they represented. So I took 62 at 4,000 in 2023. I always like to kind of have and that was in 2023. They said that they didn't say they had 628 visits, and in 25 it was 807 visits.
As for Granite, if you look at the document they gave, it actually says there's 298 visits, not 240.
Oh,
Or 298 patients.
He said 240 to us, that's,
Uh-huh.
but also he was.
On the bottom, that's at the very bottom,
Yeah.
right?
Yes.
I don't think you can, what is the difference between Lakes Region VNA and Granite VNA? Are they just two different companies?
And Franklin, all three of them.
So they're all 3 different companies.
Yep.
But and Lakes Region VNA, where are they housed?
They're all visiting nurse association.
I just,
And
I don't,
It's a national criteria.
I'd like to know what our neighboring communities,
I know.
what they're requesting through the county for.
Can we find that out? Is that possible?
Well, what are
Yeah,
they
I can
asking?
tell you right now.
Huh?
I can tell you in a second.
Oh.
What they requested last year. Keep it on mind.
Well, I just, I don't know. You don't wanna.
We have an aging community.
It is huge.
I mean, you gotta be a little bit cognizant of.
And then at the time, I know when we needed a visiting nurse at home, actually it was Concord DNA that came because we were so close to the, Merrimack line and we were at Concord Hospital, and so they came into Belmont County, which was nice, but But I also know the woman that's there is now,
So none of the VNA's requests from the county at least.
None of them do.
CASA, Community Action, Leadership Mental Health, Belmont County Conservation, and UNH Co-op.
so they don't request at all? Okay, well, that's good to know, because now we're not quote unquote double dipping. When we pay the county, what we owe the county, we're not
So
paying.
the ones that we do support that go to them, so Leadership Mental Health requests the 32, got 32, Community Action 56, and CASA 10,000, got 7,000. The biggest one is UNH Co-op at 165.
UNH co-op?
Yeah, Bob, type of.
Oh, yeah, that's 4-H,
Yeah.
that, and the reason they're pushing for that is because, their funds have been cut, so they're throwing it back on the counties. That's a big hoorah at the county level, fairground.
So do you have additional questions that you want me to get information from these places on before you make a decision? Because that would be me.
Well, the problem is, okay, here we go again, okay, you know, what they sent to Laconia has no bearing on us, it's a city, all right? So when I look at something like this, I'm looking at Belmont, Wilmington, I'm thinking Belknap County. Then you're going, what?
Shambton.
Salmon,
So
Salmonton,
it's Guilford, Gilmanton, Samberton,
Guilford,
I
Guilford,
mean-
Mazo, you know, it's always,
Hilton.
we can't compete. So I guess it would be nice to know what they're requesting through those other somewhat similar towns. I mean, we can't, you know, Laconia's city.
But if you're looking at it residence to residence,
Yeah.
maybe the information for Laconia would still be helpful if it's, you know, if you do a little bit of math and you
Yeah,
figure
and
out,
do
okay,
it
they're
per-
asking for such and such per resident, it might still be useful information.
Yeah,
Well, if you add up the requests from all three agencies, it comes to 22,500. Okay. Granite VNA has one service that the other two don't have. They have the hospice house at Concord Hospital. Which when you have a family member dying and they don't want to die at home, it's a phenomenal.
Yes.
So it needs to be had.
Yeah.
So I was thinking that maybe if we gave them the 11,000 that they asked for, because it's half of what they've been asking for the last couple of years, it's what we gave them last year.
Yeah.
And then gave Franklin VNA and Lakes Region VNA 5,000 each. That would put it at 21,000. And it's a little bit cheaper, but a little bit fairer, I think.
Why don't you just add,
I'm not comfortable raising someone's request though.
Oh, because
If
they asked for
requested
more.
something from us, but I don't see
Yeah.
why we'd give them more than what they requested. Good
Mhm.
point.
Yo. So why don't we go, okay, here's you know. Like chapter 4, and actually, oops. Lakes Region VNA requested 5 and 25. So why don't we do 4, 5, and the 11? I mean, it's,
I'm missing on the.
Franklin VNA, we'll do the 4.
yeah, that's what they requested. And then I'm thinking Granite VNA do 5.
well, you grant VNA, they're asking for 11 and they.
No, I mean, I meant,
So
Lakes
you grant
Region
VNA,
Lakes Region VNA do 5 and do 4 for Franklin and then keep the 11 for Granite VNA. No,
Probably, well, I'd probably be more comfortable. I mean, I'm gonna go lower than you, I'm sorry. I think just as the amount of residents like Region VNA,
Yeah.
I think 4 for them would be
okay,
okay.
so 4, 4 and 11,
Well, and then 11 is my other. I don't know, hold on, let me debate this in my head real quick.
you're not old,
I'm not, I know, I get it, and I get that, my wife's grandmother had hospice and it sucks for families to go through. I just think 11 is a little crazy for 290, I mean, they're the over triple what, 40, okay, whatever, I see it. I had to wait on my head, sorry.
Okay, so we'll do 11 for Granite B&A as they requested. We're gonna do 5 for Lakes Regional B&A,
Yeah, I'll, yes.
okay, and then keep the 4 for, Franklin B&A.
I'm just gonna be.
4 and 4.
Huh?
I thought you said 4 and 4.
Travis got me into 5.
I didn't, I was trying to talk down.
Oh, is that what it was? He was trying, yeah. Well, I mean, it's up to
It's
you guys. We do the 5, it's the same as what they requested last year that they didn't get, they only got 1,200. So.
Well, they weren't gonna get anything, and that will be another problem that we'll have to come up with, because they didn't get their application into the Board of Selectmen in 2023, so they didn't actually get any
That's
money.
right, you're right.
So if the budget defaults, Franklin, Lakes Region V&A would technically not get anything unless we gave it to them special.
Yeah, that's right.
Oh, the defaults will get 22 for granted, so we can find it somewhere in there.
Yeah.
Cause we're actually below default,
Yes, we are.
we're at 68,800 and 68,839 and default 68,891.
There you go. We'll give them $2 to.
Alright, whoever wrote this down, can you just read?
Yeah.
Okay.
I'll go. 8,500, 11,000, 5,000, 15,000, 0, 0, 14, 18, 0, 19, 921, 4,000, 3,000, 0, 1,000.
So you're almost, you're under default.
Couple bucks under default.
And instead of putting Colleen through the process next
We can
year,
think about it for next year
Yeah.
though, and
We
add
have the
that
specific question.
next year when we're collecting information.
I think we'll have plenty of time until they go to the budget committee. I think we can certainly get that information and you can still get.
sure, and something else to
You
work
know.
with.
I went on,
It almost seems like there's no formula to what they're.
No, there isn't. And the problem is each agency does something a little different than the
Yeah.
other.
Some are more brave, they ask for more, some probably timid, they ask for less, because they just want something.
Yeah, it's always been kind of up, go bigger.
And-
Okay, on to the Heritage Commission.
Well, Donna is here.
Oh, okay.
Do you want a motion with the health agencies now that you've settled that and you're not gonna adjust any? You can do them if you'd like.
I'll make the motion that we accept what's the bottom line?
$60,839.
839.
But
Yes, 68839.
health agencies,
I'll make a motion that we approve the health,
yeah.
the balance of the health agency being $68,839.
A second.
All in favor?
Aye.
Aye.
And then, if we can we go back to Donna's and, I still am waiting for the health insurance and.
Yeah, I think we decided that we weren't gonna do anything until we had the health insurance numbers.
Actually, her health insurance is in my budget, so you can actually
Do
move
that?
forward with approving all of Donna's if you want to. Just so I can get them printed and off to the budget.
I'll make that.
So we're not gonna make any changes,
No,
okay?
unless she's gonna make them right now on the spot.
Do we have to do it by subcategory, or can we just do bottom line?
Just about.
You can do both.
I have a motion for the budget for general assistance of $264,518.
All in favor?
Aye.
What was that number again?
$264,518. Do we do the library too?
Library does have benefits in it, but I can't have it on that one yet. Patrick does have benefits, so I can't have it on that, so let's go back to. Cemeteries you can vote on.
I'll make a motion that we approve the request of $26,000 for the cemetery. Got a second?
I'll second it.
Jeez, that's all in favor? Aye. Any opposition? Hearing none. Any abstaining?
Wait, that really wasn't votes.
Oh, what?
Anyone opposed?
Anyone opposed? Nobody said no, so
I didn't ask that, sorry.
Do what?
I didn't say no.
No. Nobody said
Okay,
no.
so 401.
No. Do what else?
Heritage.
My cottage is up for,
What? What'd you say? The cottage what? Is burning up?
Are in dark, but, I guess the owner didn't pay the light bill.
Oh,
You can't make it.
So, tab 6, move on to the heritage.
okay.
All right, thanks, guys.
Bye now.
Thank you, Donna.
Thank you.
Did Vicky apologize that she wasn't able to be here?
Yeah.
Their request is flat, it's been for
Yep.
many, many years.
That is actually number 6. There's no change at all.
$250.
That was the actual spend this year.
Oh, okay, $250 for this, and then 45 or.
That's just what they said.
Is there a
Yeah.
request for next?
Yeah, it's the same as Ben
You
for,
would do this before we got Vicky's sheet, because we didn't know what she was on.
Yeah, but their budget is 250, right?
Yeah.
Is it the heritage
Budget.
figure?
Yeah, it's number 6.
That's
Yeah.
not on the fifth, right?
So is there warrant article 25?
no, the warrant.
That must be.
That's 9.
Oh, 9.
No, well,
No,
the-
fifth right here, right?
Yeah, if you look at the supporting
projects.
documents that she provided that kind of after we had already printed your books. So she said that they're requesting for next year just the 2,500 plus the 250. So it's a reduction from last year.
oh, okay, I see that now. The 2025 budget up top threw me off.
Oh, yeah, that was 2025, and then so they've reduced it.
So they want their warrant to be 2,500 instead of the 45?
And the budget 250.
So the 4,500 is
Really 25.
2,500
Yeah, 25. Plus the 250.
plus the 250.
So,
What does that amount to?
$2,750.
But you would really only be voting on the 250 because the warrant article is separate. You would vote that really in your capital when we do that, but I mean, you can vote on it now if you want to. It just wouldn't be, like, don't say 4750, I mean, don't say 2,750.
So I make a motion for their $250 for their budget.
Yes,
and I'll second that.
All in favor?
Aye.
Aye.
and then you can.
I
make
make a motion for their warrant article 2,500.
Aye, all in favor?
Aye.
So that will be changed when they go, moves forward to the budget.
Yeah, I just on that right now. Like I said, this was printed before I go through.
Number 7 is debt, principal and interest. Yeah.
So that is, your next page at 7. That is the debt that we currently have. We did drop off some debt in, so you'll see my detail page. The Pleasant Valley project was paid off in 24, reducing the budget in 25 by 17%. The Holy Road project will be paid off in 26 with the final payment of Holy Road in 26, which will reduce the budget then by 13.32%. As of right now, you guys have not come to me to ask to take on any new debt in 26. If from now until the final day of changing the budget, if you guys want to instruct me to take on new debt, to either to take a bond for the mill or any other projects that we need to look at fixing or replacing or building, this is where that would go.
Well, would it would go there until after the warrant?
Yeah, you're right. Never mind what I just said. Back that up. Back that up. So this is the debt, and really, 254,923 for a debt payment a year, for a town of our size with our budget is really, really good.
And all this fall, anyways, so it's required, so this carries over.
Yeah, that was voted on many, many moons ago. Your question is in the sewer budget.
So we get this one. We're good with this one.
Yeah, there's no change to this, it is what it is, those are our payments that we're obligated to pay,
Anyways,
26 and then 2040.
I'll make a motion to, accept the 254,923 as debt, interest, debt, and anticipated debt.
Second that.
All in favor? This isn't gonna be pretty.
Illegal.
Number 8,
You have an update of the.
do you?
Yes. So. You have, so you have the current 44. That's increased to 53.5.
We're gonna go over that probably, I suspect.
Yes.
Um,
The union negotiations that are still continuing this year and some other legal issues that we have on our plate.
Yeah.
Yes, 60 will be definitely over, we'll overspend 60. The only thing in the positive, next year we won't have the union negotiations. I mean, last year I spent 64.6, this year I'm trending to spend 60.
we're hoping we don't have the union negotiations.
We're hoping, yeah, if they don't pass them, will they? They'll probably bring it up if the union contracts fail, they'll want to obviously bring them back up in 27, so we'll have.
Extension.
Possibly more negotiations if we come.
We're still dealing with Walker, we've still got a couple employee issues going on. And what kind of trouble is gonna happen this coming year, we don't have any idea.
So Walker would come out of the land use budget. The only good thing is, land use has its own legal budget.
Right.
And the code enforcement building inspection has its own legal budget. We haven't been spending out of it. We have, I believe those department heads have reduced their legal line down because we haven't been spending it for the last couple of years. So in the event that we did have a default, we would have some money to pull from their legal lines to kind of cover. But we are still in a default of 35,000 and we're actually spending almost 70, so.
Well, I think 60, we're gonna overdo. Well, we're gonna overdo 60 this year already. And you think 60 is enough for next year? I would question that.
If it's enough, knowing that I'm probably gonna pull the extra from the other two budgets if need be.
And for some reason, our
Yeah.
20,000 went through with flying colors, so we hopefully this year they'll give us that 20,000 of unanticipated expenses that we did
Oh, that's right.
last year.
Yeah, we have to go back.
Contingency, the contingency fund, yeah.
Which I do need to bring up to you guys in probably October, well, November, to say, do you wanna spend it or do you wanna let it lapse, so.
But we can't let lapse.
No, it falls
You
back
gotta-
into the general fund.
It would go to the general fund.
Right,
Fund
right.
general.
So we can spend it on something else.
Where do we pull the money for the dump truck will come?
That probably won't have to be paid for until 26, because it's still not approved by government council yet. And then by the time they get I mean, they're in the process of probably building it delivered, probably won't be till 26.
So that will come out of capital.
I think they're anticipating that to come out of highway block grant,
I mean,
which we do have that.
It's not a huge amount of money.
No.
But.
still money.
And we have those funds probably this year that we will have able to encumber next year and then more highway funds from next year.
So you feel comfortable leaving it at 60 then?
I only feel comfortable leaving it at 60, knowing that I have the other two legal lines to pull from if need be.
And but you said they're reducing their legal lines, is there gonna be enough even if they reduce their legal lines? I don't know what those legal lines are.
Yeah, I don't know if they. Yeah, they don't have a lot on the. I guess you'd say docket that we're, I mean, Walker's probably gonna be probably many years of fighting that one.
Yeah.
Right.
You know, like, you know,
How much that is, but that. Well, I guess, you know, something. I recommend we don't vote on this yet until we see how our next 2 or 3 meetings go. With our unions. I think that one, this might be one that we just kind of.
yeah, you don't have to vote, yeah, we can, that's why I left the last meeting for cleanup.
Yeah, let's just hold up, my 2 cents worth is to hold off on this and let's see how our union stuff goes in the next. Couple meetings.
So would you like me to put it to our cleanup meeting or our last scheduled meeting?
Okay.
Which one?
We go last schedule for now, and then once that gets overloaded, then push it to clean up.
Yeah.
Yeah.
Number 9 is blank, so we're not gonna do that.
Correct, that would be our insurance coverage from Primex, and I do not have our numbers yet from Primex, so I've already moved that to our. The 21st anyway, just to give ample time, if I get it before, then I'll squeeze it into one of my other meetings, again, that's a set number from Primex, they're.
Nothing we can do about it. Okay, and our trash is contracted.
Yes, that falls in the default. Right,
So all of that is, so what I didn't include, and we're on tab 10 for solid waste, if anyone has questions.
Yeah.
What I didn't include was the household hazardous waste. At the time, I didn't have what their number was, and I have since gotten it since last week, and our cost to have the household hazardous waste collection for 2026 would be $9,516. So if you would like me to, if you want to move forward with that, we can. We did put it in last year, we defaulted, so we took it out.
And the year before, so we haven't held an event since 2023. The 2023 was the last event. We didn't hold one in 24 or in 25.
so that's something like that, doesn't fall in the default, correct, Alicia?
No, I don't think so.
Well, if it was in 23.
Well, the numbers are different, that's what's throwing me off,
Yeah, it wasn't that much.
because the default for 25 shows 8,400 for household hazardous waste, but 2023 costs are 68, so that's why I know if it fell in default or not.
I don't know, I guess. I'll have to look at that one.
That was the other trash containers thing.
Did
I
we
guess-
have any crazy pushback about the household hazardous waste being
No.
gone for 2 years? I've seen.
Some people ask me about it, you know,
I just remember the last one we did. 75% of the people that came here were from Gilmington. There were no Belmont people. And I think we held it for so long, they
we
got.
don't have folks.
We needed
So
to go.
that's the other thing is we can participate
Mhm.
and our Belmont residents would have to go to Laconia or Northfield or any of the other places, which is, I think, what Gilmanton and a couple of Alton and somebody else do. They don't have an actual location. Your people, and they have it like over different weekends over the summer. So if you can't make it one weekend, because you're like, our weekend is always when I'm away on vacation. So I'm never here for ours when we've held it. So I would be able to potentially go to.
Right, that's right, we weren't hosting at all, we couldn't go anywhere, that's
Well,
right.
and what's the big, what do they collect?
Paint.
Paint, yeah.
Hey,
Batteries,
yeah,
lights.
Yeah, fluorescent lights,
I mean, not supposed to throw those in the dumpster,
Well,
I can't. Don't tell me you can't. You can't. That's not you did. I just did.
And obviously the highway department's there to collect,
Oil, yeah.
oil, for their burner,
I just dropped mine off of that.
I would like, you know, when you know, like I get these big these big things of hydraulic fuel. And you know, you can tip it upside down, you always got residue, I bring those. That was my contribution. Because they typically don't take TVs or anything. When we first did it, the fire department did take that stuff, but they don't take any of that stuff.
I wouldn't be opposed to getting rid of it, yeah. I mean, I just didn't have everything we did cut. I didn't really hear too much about it. I heard complaints about other things that were cheaper that we cut.
I think I answered 3 calls. Rod does get calls because he's kind of, he's the,
Yeah.
technician.
Yeah.
And he's been trying to,
Yeah, we got a price for us to have our own private event, and I think it was almost $16,000. Yeah.
so do we add it? Do we keep it? I mean, do we mix it? Do we
I'd
add it?
like to add it, just because we haven't had it in a couple of years.
And they base that number off of our population.
Yeah.
If you're wondering how they do.
Well, like, I'm trying to avoid defaulting.
Right, and the other issue is.
We need to be able to lock in location.
We're gonna hold it at the highway garage or the fire station. I think we had to hold it at the fire station because the highway garage didn't have enough pavement.
We were gonna propose it to go to the highway station,
For the traffic,
the traffic.
or we could say we won't.
Folks, they go to Laconia, go to
You need
Guilford,
to go to one of these other locations, would be the other option.
but you still have to pay for it.
So that-
Right, you still have to pay to belong to the conglomerate.
I'm sure they said that the highway department didn't have it on paper.
It's
I don't know,
like,
it's
Sharon
years
said,
ago.
You know something? I'm gonna say no. And I say that only because here we are default, you know. Yeah,
we just can't default again, because like what's killing us, and I love our staff, I don't get me wrong. We need to be able to lock in their wages on a budget. And once we get a budget passed, their wages then lock in for the next, if we do get defaulted. So I think our biggest goal this year is to not default. So we have to cut this as tight as humanly possible, and I know we're gonna get shit for it, some of us might not get reelected for it. But if we get a budget passed, I'll go happy singing if we get a budget passed and I don't get reelected. I don't care. We need to get a budget passed to lock in wages, or we cannot continue this same old of trying to scratch pennies to pay these pair employees.
So you gotta find a way to bring the default almost in line.
Almost damn near supposed to be done in line so we can sell the budget.
Which is very hard, because now you're ranking up from
Oh,
23
yeah,
to 26, so that's a lot of a big difference.
And the hardest thing we have to make up for every time we default is just wages, because we can't afford to lose our employees.
So, yeah.
Then we might as well not have any
and
service.
the wages have increased so much. From,
23, yeah.
it's not pretty.
The only saving grace this year is that the union contracts will be completely separate from the budget number that they will see, so.
But those will pass. They'll pass.
We hope they do, we hope they do.
But I'm talking about even like non-union wages or what, because again, like you said, the wages for union goes into default, so non-union ones that we have to make up for, that's. Unfortunately, it's our management, it's all of our higher paid staff that we have to then try to stretch pennies to make the dollar. I do agree with them on this, we have to keep this as tight as humanly possible.
Is that a motion to not add it back in or consent?
I'll make a motion to not add it back in.
And I'll second that motion. All in favor?
Aye.
Aye, opposition?
Me.
Okay. So what is our bottom line now?
Hold on, and then just to note, we do take in the host fees, from Casella, which right now, we've taken about 37,000. Last year, we took in 61,000, so that
Now that's interesting.
$60,000 goes back into the general fund.
Right,
So,
but I wonder why the big difference.
well, we still have to collect.
Oh, you still have 3 months.
Yeah, yeah, and we average about 5,000 ish, well, 4,000 to 5,000 a month. I think the year before, I have it on my average.
Come down a little.
It's come down
Come down a little
some.
bit.
Isn't that interesting?
Yeah. They don't have it in front of me.
So in 24, we had 61,000. 23, we collected 60,200. In 22, we collected only 48,000. In 21, we collected 44,000. And I would say that the increase is due to the cost of disposal. In red on your sheet, you will notice that there's a new line added. This is super new. So I don't have a lot of information. I did provide it in the last sentence of your account detail. So DES is charging everybody a surcharge of $3.50 per ton. All right, so I'll just read it for you. In 26, NHDES is applying a surcharge in the amount of $3.50 per ton of waste brought to a landfill. These fees are to be used to fund DES waste programs and infrastructure grants. This will be 100% reimbursable every quarter upon proof of payment and town submitting the request to DES. Casella will be billed directly by DES, and then Casella will bill the town, and then the town will seek reimbursement. So it'll be a lot at the end of the year. But we have to.
But that's just a.
One legislator did this.
And then we can apply to the grants.
Hold
Yeah,
on.
and then we can apply
Hold
for
on,
the
hold on,
grant.
let me rephrase, understand this. They charge Casella, DES does.
Yep,
Casella charges us.
yep,
And then DES reverses us.
yeah.
And then.
But I
Only if I asked for it,
I think
and
a
proof
400
that I
is
paid
cheap.
for it.
This is why I left the legislative body.
So unfortunately, I have to raise and appropriate, and so Casella gave me the number of the tonnage that they will base it off of, so that $7,100 is based on our current, our tonnage that we have used.
So,
And then I will put it, the hard part is, I will put it in revenues, so yes, at the end of the day, it will offset each other, but people will only see that
Yeah.
the budget increased by
So it makes us,
7,000.
our budgeting process
It makes
harder,
our
not theirs
budget-
easier.
Exactly, and then no one's gonna be like, oh, well, there's an offsetting revenue in $7,000 and it's gonna be a wash. It just increases our budget. This is super new, so I don't know if they're still making decisions and details about this, even Casella's like, this, I don't even know how this is gonna work, but we're figuring it out, so I'm working with Casella.
Okay, so more reason to eliminate.
I'm hoping that maybe because it's a wash, that I can put it somewhere not in the operating budget.
Yeah, it's gonna
To
happen.
avoid
We're
what
expending
I'm
it, because we're expending it, has to go.
If you can spend that, no, well, I don't know.
You could treat it
can
like
spend
grant.
it out of revenue.
And
If
can,
you
if
know
the-
you're getting reimbursed.
you know more than I do about
Yeah,
that.
so I think if it's quarterly, I think we may be able to spend it out of revenue, knowing we're getting it. Back, basically guaranteed. I think the auditors told us that. Not on this particular issue.
It would be something I'd ask them before we.
Yeah, I can speak.
Solidified it there, but.
Vegas, yeah.
Now I'm putting it there, but yeah, that's something new that has come down the pipe just recently.
So we really don't know what the final figure is, so we can't vote on this
Well,
anyways.
No, you will,
Oh.
that's the number I'm putting in, because that's the number that, that's the 350 times the,
Tonnage.
time the tonnage, which, Casella gave me, which was like 2,000. 2,027 tons is what he gave me as a number to estimate. But first when I was thinking about, like, 350 a ton, I'm like, oh my god, all this garbage that we bring there, I'm like, I'm gonna have to like. Hundreds of thousands of dollars, like, no, it's only this, I was like, oh, 7,000 is not the worst, but still, it.
A ton of trash. You know, it's a lot.
I think part of it is though, they're reimbursing municipalities, but if you're a regular citizen and you go bring your stuff. They charge you that 3.5 and they
Or
keep it.
business, they won't be able to
Keep
get
it.
reimbursed.
Commercial disposal and stuff. So they'll.
Yeah, so they got money maker.
They should eat it for pounds.
They- Right.
Paid for us.
The money, the amount of time and effort that goes into this.
Paperwork keeps.
Staff, they have to
The
pay.
staff, stamp.
And our time too, right?
Right. Okay,
I'll make
so
that motion.
we need, yeah, did we make, yeah. What did
Yeah,
we do?
it'd be 794,395.
Oh, okay, got it. All in favor?
Uh,
Any opposition?
Well, they didn't have to hold a gun on it, pretty cool.
Oh, the next one's adjourned.
yeah, I'll make that motion.
Who's that?
That's my motion. Yeah.
Second.